What you're about to see is a very detailed account of my experience with an orthodontist named Dr. Bill Heng. My hope is that this will serve not only as a cautionary tale, but also as a source of encouragement for any patients out there who may be getting disrespected, disregarded, and manipulated by the very healthcare providers who are supposed to be helping us. As you'll see throughout this video, I've made countless attempts to resolve this matter privately before ever making this public. But it's become clear to me that Dr. Heng has no intention of taking accountability for his actions. I'll start with a general overview. When I was 13, I started having this indescribable chronic jaw pain, and I've been searching for relief ever since. 6 years ago, I found an orthodontist online named Dr. Heng, who had developed this novel treatment for addressing my particular type of jaw pain, or so it seemed. His social media accounts had tons of testimonials from patients who spoke so highly of him and his treatment. His website showed that he was a credentialed and internationally known orthodontist, so I never thought to question the safety or validity of the treatment he was performing. Instead, I was so excited that I had finally found a doctor who might be able to help me, so I reached out. My family went into nearly $20,000 of debt, and I agreed to fly across the country for years to receive what I thought would be a life-changing treatment. And I was right. This treatment would be life-changing, but not in the way I expected. After months of Dr. Heng exposing me to excessive amounts of radiation through needless x-rays of my face, using appliances to pry my teeth apart, and then dealing with these awful open sores in my mouth from all the friction, I was still in pain. I told him that I was still having symptoms, but out of nowhere, he switched gears, telling me that I was mainly getting his treatment to look better, not to relieve pain, and that I should just be grateful for the aesthetic improvements he'd given me. I was so confused. I spent the next months trying to convince him, both in person and through emails, that the primary reason I sought his care was because I was in pain, and that's why I was traveling thousands of miles and sacrificing so many years of my life for his treatment. It's not that I wouldn't welcome improvements in my appearance, as most people would. It's just that my appearance was not my primary concern, but he kept ignoring my symptoms. Eventually, he told me that my smile looked great, and he decided he was done with the treatment, so he took my braces off. That's when I realized how much damage had been done. My smile is super weird looking now, and my teeth are sticking out. I have bone loss in my jaws, gum recession, extreme sensitivity, and I'm at risk of losing my front teeth. I had to have periodontal surgery to try to fix the damage to my gums, and I now have to wear partial dentures. This whole thing has honestly been a nightmare. But unfortunately, the story doesn't end there. A couple of months after my treatment ended, Dr. Heng's office emailed me asking if they could post my pictures online. I was confused why they would want to post about me, considering how messed up my mouth is. Luckily, there are patient privacy laws in the US, which makes it illegal for doctors to disclose their patients' information without their consent. I had moved far away at this point, and was trying to put this whole situation behind me, so I never responded to their email, and I thought it was over. But it turns out, Dr. Heng went ahead and posted my treatment pictures anyway, without my permission. Not only that, but he made a 3-part video series about me and my treatment, where he said my full name and the university I attended, which is a huge violation of my privacy.
Ireland is one of the most girl who was a student at and when she was growing up.
Then, he said that largely my complaints were aesthetic, which was a total lie.
Largely her complaints were aesthetic because she saw what had happened to her face.
I had told him so many times that I was receiving his treatment because of my jaw pain. For example, telling him that if I just wanted to look better, I would have spent the money on plastic surgery, and that the health of my jaws is and always has been my main focus. Yet even with all of this in writing, he kept insisting that I was mainly there for aesthetic reasons, which was super disorienting. He kept saying that I was so happy with his treatment and the way my teeth looked.
And along the way, she would send me pictures, particularly early on, and say, oh my gosh, these symptoms went away. I'm so happy, and she's very happy with the way things look.
This feels so violating, watching him speak for me and make my case sound like this huge success, when in reality, my teeth look awful, and I'm in even more pain because of what he did. He also posted before and after pictures, and made it look like my face grew forward from his treatment, which it didn't. These profile lines are completely misleading. All Dr. Heng did was move my teeth around, and yet he makes it look like the entire lower half of my face, including my nose, moved forward, without surgery, which is impossible. This is blatant false advertising, and he's forced me to be a part of it. I had many doctors urge me to sue him, but I felt a lot of cognitive dissonance about this, so I was really hesitant at first. Eventually, I did end up consulting with attorneys, but they told me how long and painful of a process this would be for me, and that California law makes it really difficult for patients to win dental malpractice lawsuits. However, the attorneys did mention that I could file a HIPAA complaint against Dr. Heng instead, because he disclosed my personal information online without my consent, which is illegal. In fact, according to the American Dental Association, what Dr. Heng did falls into the highest tier of HIPAA violation, which comes with a minimum fine of $50,000 paid to the government, and the Office for Civil Rights will publish a press release publicly stating what the doctor did. This sounded like the best option for me, because Dr. Heng would be held accountable for his actions, but I wouldn't have to sacrifice any more years of my life in the process. So I didn't sue him, and instead I filed a HIPAA complaint. 7 months later, OCR sent me a letter saying that they provided Dr. Heng's office with technical assistance to remove the pictures and videos of me, and they closed the case without an investigation. I emailed back, trying to appeal the decision, but they said that they would not open an investigation into this. This was so disappointing, and I honestly felt betrayed, because I could have told Dr. Heng to take the videos down myself. That's easy, but I thought these laws were made to protect patients, and to take action against doctors who do things like this to their patients. So yeah, the HIPAA complaint fell through, and by this point, my statute of limitations for a lawsuit had expired, so I couldn't sue him anymore. But I still wanted to hold him accountable for his actions. I mean, it doesn't feel fair that he could do all of this and never have to face any consequences. So I wrote him an email. I explained my thoughts, and I asked for him to please refund my family for the cost of his treatment, to cover my travel expenses and medical bills as a result of his treatment, and to issue a public apology for lying about my case to advertise his treatment. He didn't respond though. Instead, his wife intercepted my message and had their malpractice insurance company reach out to me to negotiate a settlement. They ended up offering me over $30,000, but Dr. Heng refused to issue a public apology, and in order for me to receive this money, he wanted me to sign both a non-disclosure agreement and a non-disparagement agreement, which meant that I could never talk about this situation ever again, and I also couldn't post anything negative about him on social media or utter a negative word about him to anyone for the rest of my life, even if it's true. So not only would he never be held accountable for his actions, but I would also have to stay silent, which would place a huge psychological burden on me. And in my opinion, it seems really unethical, publicly lying about your patient, claiming that your treatment was a huge success, when in reality, your treatment injured the patient, and then making them sign an NDA to get compensation for the injuries you caused them. I don't understand how that's legal. But anyway, I've been so conflicted about this, because I truly want to move on, and I've been trying to move on. Over the past years, I've had so many times where I decided I was just gonna put this behind me and forget about it, but it keeps coming back to haunt me. And I feel like by just letting this go, I'm letting down not only myself, but also my family and my fellow patients. When I made this YouTube channel, The Jaw Project, back in 2019, I had been dealing with this chronic jaw pain for so many years and was on my 4th set of braces to try to fix it. Because of this, I'd become really passionate about orthodontics, and I wanted to do research to help people who were having symptoms like me and to prevent others from going through the same thing. So I made a website, I made videos, I got to speak with patients from all over the world about their experiences, and I really felt like I found purpose in that. But throughout this whole fiasco with my own orthodontist, I gave up on this project. I deleted my videos, I deleted my social media accounts, I went completely dark. I was so confused and overwhelmed by what was going on with my own treatment, and I was afraid that I was spreading misinformation and just making things worse. I didn't, and still don't, want to be a public figure, and I honestly don't want to talk about my treatment on the internet because I'm still dealing with these jaw issues, and it's not really good for me to keep reliving it. But I realized that I can't let this situation go, because even though I feel conflicted about pursuing orthodontics as a career, I still care about this topic, and I care about all the other patients out there who are going through this just like me. I mean, it's already hard enough to find safe treatments for jaw pain, so to know that this renowned orthodontist, who's gained the trust of so many patients and doctors around the world, knowingly posted a false advertisement to promote a dangerous treatment, and for me to just not say anything about it, that means I'm complicit. And until I set the story straight, this will continue to haunt me. So I told Dr. Heng and his malpractice insurance company that I won't sign an NDA, and I won't accept their money. To make sure that I was 100% clear and that I gave him every opportunity to make this right, I personally sent him an email again, explaining that I wasn't going to sue him, and I asked him again if he would take accountability for his actions. But he didn't. He didn't apologize, he didn't take accountability, he essentially just told me to get over it. He also mentioned that he's retired now, which is true. He ended up retiring several months after I filed the HIPAA complaint against him. But the very important detail that he leaves out is that he's still actively teaching his techniques, hosting conferences, selling mentorships, for over $12,000 a year at that. He's still a public figure. He might not be the one personally adjusting people's braces anymore, but he is teaching doctors all over the world to perform his treatments on unwitting patients. And I can't just sit here and not say anything. So I've decided to sit down and get this off my chest once and for all. And that's where I am today, making this video. Now, I already put a text disclaimer at the beginning of this video, but I'd like to emphasize again, I have no malicious intent with this. I simply want a chance to tell my side of the story, inform the public about this situation, and to hold Dr. Heng accountable for his actions. All of my statements in this video are my personal experience and opinions with supporting documentation from the internet, email threads, and my medical records. I'd also like to point out that Dr. Heng has since sold his practice. I don't know the doctor who bought his practice, I've never spoken to him, he wasn't involved in my treatment at all. Nothing in this video is a criticism of him or his practice. All of my statements in this video are pertaining to Dr. Heng and the practice when it was still owned by Dr. Heng. Lastly, I just wanted to say that I did finish this treatment over 3 years ago now, but within these past 3 years, I've been working through legal matters and trying to cope with and find treatment for the damage done. The last time I interacted with Dr. Heng about this situation was in May of this year, 2024, and I recognize that I've taken a while to finally record and post this video. But I hope you can understand that this has been a rough journey for me, and my delay with this is not for lack of care, but I simply needed to prioritize my mental and physical well-being before talking about this publicly. So the rest of this video is for anyone who's interested in the finer details of this situation. I'm going to walk through my treatment records and emails with Dr. Heng step by step and thoroughly explain my thoughts and feelings on what happened. I'll start with my orthodontic background. When I was 7, my parents took me to see a local orthodontist. The orthodontist diagnosed me with crowding and a deep bite. Here are my initial intake photos. The orthodontist then had me wear a retainer until I was 13. During that time, I had all 4 of my premolars extracted. Here is a mid-treatment gallery from when I was 11. When I was 13, I got braces on. Almost immediately after getting the braces on, I started noticing changes in my face. I also started having chronic pain and this severe tension all throughout my face, jaws, neck, shoulders, and back. It felt like my lower jaw was trapped too far back. And this is kind of a weird symptom, feeling like your jaw is trapped too far back. So by this, I mean, imagine your lower jaw being comfortable in one position, but your teeth fit together in a different position. Because our teeth have to fit together, the lower jaw will have to make the sacrifice and maintain a position relative to your skull that's not only very painful, but very harmful to the joints themselves. So for me, when I bite my teeth together, I feel all this pressure through my jaws and ears. My ears feel plugged, and it feels like my whole jaw area is inflamed and achy. Because of this, it feels like my lower jaw should be farther forward. So if I allow my lower jaw to move forward to where I almost have an underbite, then my ears are open and there's no pressure or pain in my jaw joint area, but then I can't actually bite my teeth together because I have an underbite. So that's the problem, is that in order to chew anything, I have to pull my lower jaw back, which then makes me feel all this pressure and aching through my jaws and face. But if I allow my lower jaw to come forward and I can't bite together, I can't chew, and because my teeth don't fit together like that, I can never actually rest my jaw, which eventually starts leading to more pain because I'm constantly engaging my muscles to hold my jaw in this forward position, when my facial muscles were never designed to do this. I figured these symptoms had something to do with the orthodontic treatment I was currently receiving, since I didn't know what else would be causing these symptoms for a 13-year-old. But my orthodontist assured my parents it was fine, and my symptoms would go away. My symptoms didn't go away though, so my parents took me to another orthodontist for a second opinion, and he told us that my current orthodontist wasn't doing a very good job. I didn't want to upset my current orthodontist by switching to a new doctor though, so I decided to give him another chance. Here is a mid-treatment photo from when I was 15. This is the photo taken by the orthodontist that I got a second opinion with. At this point, my current orthodontist had given me a crossbite. I also had a pretty severe problem with grinding my teeth, so I ended up grinding down my canines. As you can see, I was really tense and had significant mentalis strain, which is pretty much when you tense your chin in order to get your lips to close, and it gives this orange peel texture to the chin. Usually you're not supposed to use the mentalis muscle much at all. My first orthodontist had originally started my braces with invisible brackets, so he decided to just start over, take my braces off, and give me a new set of traditional metal brackets to see if that would somehow help. He also gave me an expander. About another year later, all the problems remained, so I finally decided to switch to the orthodontist who gave me a second opinion earlier. This doctor put on a new set of braces again, so round 3 of braces, fixed my crossbite, and made my teeth fit together better. I was still having a ton of pain and tension, but I was fine with how my teeth looked, so I decided to just get the braces off. It was already my senior year in high school, and I'd been wearing braces since middle school. I just wanted it all to be over. So right after high school graduation, I got my wisdom teeth removed. I didn't have any infections or pain from the wisdom teeth. They were just being removed prophylactically. Then I finally went off to college. Unfortunately, it didn't go very well. At that point, I was having so many physical issues, presumably as a result of my jaw problems, and I was in constant pain. I only lasted 1 semester before my doctor recommended that I take a leave of absence and get my health under control. During my leave, I started scouring the internet for solutions to my jaw problems. I was desperate, and I just wanted the pain to go away. And that's when I found Dr. Hang. I watched all of his patient testimonials, and they gave me so much hope. I'd finally found people who were experiencing the same symptoms as me, and apparently they were experiencing these symptoms because of previous orthodontic treatment where they had teeth extracted and then braces to close the spaces left by the extracted teeth. And in closing the spaces, their lower jaw was pushed backward, leading to that trapped feeling. And according to Dr. Hang, there's a way to fix it. He had developed a protocol where he would reopen the spaces where teeth were extracted to reverse the effects of previous orthodontic treatment. I was so excited. It sounds ridiculous, but I literally thought this procedure was going to save my life. He calls the problem ERRS, for extraction, retraction, regret syndrome, and says that it's preventable and reversible. Now, the fact that this medical syndrome is trademarked should have been a big red flag, but I was desperate, and Dr. Hang's website was the only resource I'd found that seemed to describe so much of what I'd been experiencing, so I figured I should reach out to him. And he wasn't some random person either. His website listed all sorts of credentials, professional affiliations. He's a member of the American Association of Orthodontists and the American Dental Association, So I assumed what he was doing was safe, and so did my parents. So I sent him this email, where I said that I've been feeling this indescribable discomfort in my mouth and jaw. Something just doesn't feel right. I explained my orthodontic history, and that I had extractions. I said, now it's been 2 years since my braces came off, and the discomfort is only increasing. I have this terrible brain fog, and I'm constantly tired and tense. Sometimes I feel like I can't breathe very well. My teeth still don't fit together quite right, and I have to strain to get my lips together. I'm constantly aware of my mouth, trying to hold it a certain way. It causes me so much stress, and I hate the way it looks. But up until now, I thought it was all in my head, and I was just an insecure teenager who needed to get over it. Recently, I found your website, and for the first time in my life, saw people who were describing exactly what I've been feeling all these years. Just watching the testimonials alone has given me so much hope. It's unbelievable. I've been in pain for years now, and spent so much time and money trying to fix the problem, all to no avail. I really hope you can help. It would mean the world to me. And he responded, I'm very sorry that you've had 4 bicuspid teeth removed and have had this retraction. I've been reopening extraction spaces for people since 1989, and I've helped people from all over the world with this. Having said that, I'm very careful to never promise anything except that I will do my best. I cannot promise resolution of even one symptom. I don't start any case unless I think we have a very good chance of helping someone, however. Many people who contact me are not good candidates for reopening spaces. I finished an email earlier this evening to someone who's not a good candidate. His case might well require surgery to get him where he wants to be. You, on the other hand, appear to be an excellent candidate for reopening spaces. This email was so exciting for me. I honestly thought this was the turning point in my life. So I scheduled an online consultation. During this consultation, he explained his treatment protocol. He also explained some potential side effects. He mentioned the possibility of gum recession, but that he didn't think that would happen in my case. And either way, he told me that no one ever died of gum recession. I had heard of gum recession before and assumed it was just when a little bit more of your tooth shows because your gums move back. Basically, I thought it was just an aesthetic problem. I didn't know about any of the serious complications that gum recession can cause. The trivial way he described gum recession to me was very similar to how he described it at this conference.
23 years later, that's what Peg looks like. She's a dance instructor, no headaches, life is good. She's had some more work done, whatever. She's got implants in down here now, but that's the amount of recession she has. I'm guessing she's not going to die of recession. You know, I do read the obituaries, and I'm looking for those patients that die of gum recession. Have any of you ever seen that happen? I didn't think so. Okay. But you know, people die every day of sleep apnea-related issues.
He also mentioned that he could accidentally give me an open bite, and that could only be fixed with surgery. Considering the amount of pain I was in, I thought these risks were a small price to pay to potentially have my jaw problems fixed. Here are his treatment notes from the online consultation. Notice how only one sentence in this entire note mentions aesthetic complaints. The rest details my physical symptoms. But also, the only aesthetic complaint he wrote down is that he says that I disliked my narrower smile. But I never disliked my narrow smile, because I never felt like I had a narrow smile. That wasn't a concern for me. So I really don't know where that comment came from, but I'll return to that in a minute. He notes that I have extensive cervical pain. He also mentions a protocol to recapture the disc, but he never brought this up again after the initial consult. I would have expected him to bring it back up again, considering all the problems I was going to have with his treatment, but he didn't. Based on the way he presented himself online, I truly believe Dr. Heng was a TMJ specialist and one of the best orthodontists in the world. The treatment was going to cost $19,500, not including additional fees and travel expenses. But my parents and I didn't question it, because he was the creator of this novel treatment protocol that was saving lives. So I figured this was just the price you had to pay to get treated by the best of the best, and I trusted him completely. I scheduled an in-person appointment for January 2019. When I got to this appointment, Dr. Heng palpated my facial muscles and noted the loud clicking on the right side of my jaw, which was loud enough to hear just by sitting in the chair next to me. He didn't even have to use a stethoscope. He measured my intermolar width and jaw opening distance, then he took a CBCT scan. He showed me what it looked like and told me that I had jaw joint distalization and degeneration, especially on my right side. Then he gave me the first set of appliances to begin opening spaces. As a general overview, Dr. Heng's protocol involves using sagittal appliances with screws in them. You turn the screws every 4 days or so, and it opens up spaces. First, you start with just using the upper appliance to create a slight overjet. Then you begin with the lower appliance. You keep turning the screws on both appliances until you reach the end of the screw on the upper appliance. Then he'll make a second set, and you keep wearing both, turning the screws until you get 7 millimeters of space on each side. This process of opening spaces is what should relieve any pain symptoms. Once you reach this point, you get braces to upright the roots of your teeth and prepare for implants to fill in the gaps. The informed consent papers Dr. Heng had me sign were very standard consent forms for orthodontic treatment. I agreed to all risks, because I already had 3 rounds of braces before this, and the only complication I had was some decalcification, so I didn't anticipate anything crazy happening. But looking back, I now realize that this wasn't a standard orthodontic treatment. The likelihood of complications was significantly higher due to how extreme this treatment was. While Dr. Heng never promised the resolution of any symptoms, there was also never a plan for if the treatment didn't work. I didn't question it though, because Dr. Heng didn't seem to think that a plan B was important, and I certainly didn't know about orthodontics like he did, so I just trusted his judgment and let him take the lead. Here are his treatment notes from that appointment. He says, I had some slight to moderate muscle pain. And here are his handwritten notes from my in-person appointment. Interestingly, the reason for visit section has been left blank. Also, according to his muscle tenderness scale, he notes that I have moderate tenderness in my masseters, SCMs, and trapezius, as well as severe tenderness in my scalenes. But he wrote in his treatment notes that I only had some slight to moderate muscle pain. In my scanned hard chart, it's noted that I have headaches, pain and/or clicking in jaw joint, and grinds or clenches teeth. Here is the first gallery Dr. Heng took of me. Notice that my smile is not particularly narrow. It's not the widest smile, but I don't even have noticeable buccal corridors, which are the dark spaces at the corners of your smile that typically indicates a narrow arch. Also, I had an expander when I was in high school, so my smile was already made wider. All of that is to say, a narrow smile was not a concern of mine, so I really don't know why Dr. Heng wrote that down. While I was not upset about my smile being narrow, I did, in my initial email, say I hate the way it looks. By this statement, I was referring to how, whenever I allow my lower jaw to come forward so it doesn't feel trapped, it really doesn't look right. It gives me an underbite, and it makes my face look very unproportional. I also have to strain to get my lips together, which doesn't look very good. So that's specifically what I was referring to with this statement. But anyone in Dr. Heng's position would have, and I believe should have, understood that all of these aesthetic concerns were really just symptoms of the underlying structural problem that was causing pain, and that if the underlying problem is addressed, all of the symptoms pertaining to function and appearance should be significantly reduced or resolved altogether. So I'm going to take a step back for a minute to explain a little more about Dr. Heng's theory behind reopening extraction spaces. First, here is one of his YouTube videos where he explains why the lower jaw becomes trapped, a condition he refers to as mandibular entrapment.
This segment is entitled, What is Mandibular Entrapment? Mandibular entrapment can be defined as basically the biggest reason that you have lots of TMJ pain patients in your practice. And let's look at and see how this happens. Many patients present for treatment with crowded lower incisors in a class 1 occlusion like this. They have no crowding in the upper arch, but moderate to severe crowding in the lower arch. I was taught to remove 4 bicuspid teeth in cases like this, but I don't do that anymore. Let's explore what happens when you do that. Here then is the lower arch, and you see what happens to the lower arch as the lower incisors are aligned. After the alignment is complete, you see that there's some space remaining. Usually 2 to 3 millimeters of space remains. In the maxillary arch, however, there's still a full space left because there was no crowding to begin with, and no retraction has occurred. So you still have a 7 to 8 millimeter space there. If you look at this from the side, you see a 2, 3, or maybe 4 millimeter space in the lower, but an 8 millimeter space in the upper, which needs to be closed. So you close the spaces in both arches, and now you see here in this depiction, there's no space in the lower arch, and yet there's 4 or 5 millimeters of space still left in the maxillary arch. But if you look over to the left-hand side, you see that the incisors are in contact. So what does that mean? If there's no overjet and you continue to retract in the maxillary arch, what is going to happen? Pretty easy to understand this drawing when you see the bulldozer pushing back on the upper incisors and realize there's no place to go. And the other arrow points to the distal of the condyle. And everyone knows the anatomy in this region and knows that distalizing the condyle is not a good thing. This is essentially what mandibular entrapment is about.
So what I get from this video is that, according to Dr. Heng, the reason why the lower jaw is trapped is because the upper front teeth are too far back and are bumping into the lower front teeth, which makes it so you can't bite together naturally. Instead, you have to pull your lower jaw farther back to overcome that interference, but then the molars don't fit together. So reopening extraction spaces is supposed to relieve interference between the upper and lower front teeth by pushing the front teeth forward, which then allows the lower jaw to move forward and the molars can fit together again. Now, this theory does make sense, and I'm sure it is the case for some people. I'm sure that's how he developed this treatment protocol in the first place. The important problem here is that this was not the case with me. I never had incisal interference, and this is clear from the very first pictures Dr. Heng took of me. My molars fit together very well. My front teeth were not getting caught on each other. That was never an issue for me. I never mentioned that in my initial email. I can't ever remember feeling like my front teeth were getting caught on each other. But regardless, simply the fact that my molars fit together means that I did not have incisal interference. The pictures are all we really need to rule this out. Yet I still had the symptoms. This means that this condition of feeling like the lower jaw is trapped is not simply a matter of incisal interference. Maybe it is for some people, but it seems to have multiple potential root causes. Recall the cause of this issue that Dr. Heng pointed out. He says mandibular entrapment happens when there's crowding in the lower arch, but no crowding in the upper arch, and then 4 teeth are extracted. Then there's more space to close in the upper arch, and this disproportionate retraction of the teeth causes the upper front teeth to be moved too far back and start hitting into the lower front teeth. But if we look back at my old pictures before any teeth were extracted, my upper arch was severely crowded. In these pictures, I had crowding, but my canine teeth hadn't even come in yet. So when I got braces, they didn't actually close any gaps. But yet, when I got braces, suddenly my lower jaw started feeling trapped. And this is what my occlusion looked like when I started treatment with Dr. Heng. I could bite down completely, which means my front teeth were not hitting prematurely or preventing me from biting together. Therefore, I did not fit into this category that he's referring to, where you have crowding in the lower arch, but not the upper arch. I was severely crowded all around. But the question remains, why did my lower jaw feel trapped if I had a perfect occlusion? Well, this implies that I have a skeletal issue, an actual issue with my jaws themselves, not my teeth. Something must have happened while I was growing that created a discrepancy between my upper and lower jaws, where now, in order to get my teeth to fit together, I have to pull my lower jaw back, which pushes my condyles into the back of the socket, causing pain and making my lower jaw feel trapped. But I have a good occlusion. And this is kind of a subtle distinction. So, to reiterate, it appears as if there are 2 potential types of patients who experience this feeling of their lower jaw being trapped. Type 1 is that their front teeth are hitting into each other, forcing them to pull their lower jaw farther back in order to bite down. But this, of course, forces the jaw condyles back in the socket, leading to TMJ pain, and their molars don't fit together. The other type of patient, the category I presumably fall into, type 2, is when there is an actual skeletal discrepancy. In this case, the teeth fit together perfectly, but the upper jaw itself is too far back. The whole upper jaw as a unit, which then makes it so that in order to bite together, you have to bring the lower jaw backward, which forces the jaw condyles back in the socket, leading to TMJ pain, but the molars do fit together. In this case, a possible treatment, from a mechanical perspective at least, would be jaw surgery, moving the entire upper jaw forward, including all of the upper teeth, and that will allow the lower jaw to move forward and the TMJ pressure to be relieved. I really, really hope that I've explained this well enough. I know it's a subtle difference, but this is the core of the issue here. Mandibular entrapment is either caused by the teeth or by the jaws themselves, and these two types of patients require very different treatments. Based on my personal experience with Dr. Heng and my interpretation of the information he posts online, it seems like he believes that incisal interference is the cause for all patients experiencing these symptoms. So what you're going to see as I continue through my story is that he seems determined that my front teeth are interfering when that was never the case. I didn't recognize that this is what he thought until further into my treatment. But it seems like Dr. Heng went into my treatment convinced that my front teeth were interfering and held on to this determination despite me repeatedly telling him otherwise. And despite it being obvious, just by looking at my teeth, that my front teeth weren't interfering. Going back to my first email, I said, my teeth still don't fit together quite right. This may seem like a contradiction because my teeth fit together quite nicely. But to clarify, when I first reached out to Dr. Heng, I had a lot of trouble properly describing my symptoms. It's only later that I realized the best way to describe what I was feeling is that my lower jaw was trapped. But before I started treatment, I had never heard that language used before. My statement in this email was referring to how my lower jaw feels like it should be farther forward, but whenever I bring my lower jaw forward, my teeth don't fit together. This statement may very well have confused Dr. Heng into thinking that I had type 1 mandibular entrapment, like I just described. But even if my initial statement did confuse him, after my first in-person appointment, he should have realized that my molars did, in fact, fit together, simply by looking at my teeth, and therefore I was not a candidate for his treatment. While it's unfortunate that I wasn't very good at describing my symptoms when I first started treatment with him, by just a few months into treatment, I'd found better ways to describe what I was feeling, and I made it clear to Dr. Heng what I was experiencing. Looking back, I now know it was never my responsibility to diagnose myself, only to express my symptoms as a patient the best way I knew how. It was Dr. Heng's job to consider all that I told him against the backdrop of his exam and images, and to reach the right diagnosis. So anyway, this difference between types of patients is a big deal because Dr. Heng's treatment only works on type 1 patients. And there are actually consequences to reopening extraction spaces on someone who doesn't have incisal interference, a type 2 patient like myself. This is how my bite started, a good occlusion. By pushing my upper front teeth forward, all this does is create an overjet. It didn't allow my lower jaw to move forward because my molars already fit together. Also, while the appliances push your front teeth forward, they also push your back teeth backward, which is a demonstration of Newton's third law of motion. So in a case like mine, by wearing this appliance, my upper molars were pushed slightly backward, which then moved my entire bite relationship farther back and moved my lower jaw farther back, increasing the feeling of my lower jaw being trapped. So once I got the braces on, and no longer had plastic appliances propping my bite open, it felt like my bite was even more trapped than when I started, which was the opposite of what I was trying to accomplish. But now I realize what was happening, and it's that the upper appliance was pushing my molars backward, which moved my entire molar relationship backward. So not only was reopening extraction spaces not going to do anything for me because I already had a good occlusion, the fact that I had a good occlusion made this treatment contraindicated for me. In other words, this treatment was likely going to harm me, and this was clear from the first day I walked into his office. But going back to the story, in February 2019, after about a month of using the upper appliance, I noticed that some of my symptoms were starting to clear up, so I sent Dr. Heng this email to share the good news with him. This is the email that Dr. Heng would hold on to for the rest of my treatment. Now, everything I said in this email was truthful. I was feeling better. At first glance, it might appear as if Dr. Heng's treatment was working. I was using his appliance to push my front teeth forward, and suddenly I was experiencing relief for the first time in years. But there's a key piece of the puzzle that Dr. Heng doesn't acknowledge. Not only is there a wire component to his appliances, which is responsible for moving the teeth, but there's plastic that covers the roof of the mouth and goes in between the teeth, much like a TMJ splint, which is a well-known conventional treatment for TMD. The role of a TMJ splint is to prop open or separate the upper and lower teeth and create a biting surface that's independent of the cusps and grooves on the teeth. Because of this, the jaw joint space is increased and the lower jaw can go wherever it wants, independent of the way the teeth fit together. So the jaw can finally assume the correct anatomical position. So when I was wearing these bulky appliances, my entire bite was being propped open, and my lower jaw was able to slide forward on the plastic, which is essentially what a splint does. So, of course I was going to feel better, because I was effectively wearing a splint. Another indication that the changes I was noticing were because of the splint effect is that I mentioned that I was noticing changes in my appearance, but my teeth had hardly moved at that point. So what would have been causing changes in my appearance this early? Well, the changes I was noticing were because my lower jaw was now positioned farther forward, making my jaw look stronger than it actually was. To help show this splint effect I'm talking about, here is a gallery that Dr. Heng took at my appointment in May 2019. You can see how the appliances are holding my teeth apart. On the right is yet another gallery from the appointment when I got my braces on. But you can see that over the past few months, my lower jaw has shifted even farther forward, to the point that my lower lip was now further forward than my upper lip, and my molars are nearly edge to edge. For further comparison, here is a side-by-side of my first picture at Dr. Heng's office and a picture from when I got my braces on. These pictures are only 9 months apart, yet I look noticeably different. I didn't have surgery, and my lower jaw didn't magically grow. Instead, my lower jaw was allowed to slide forward and get used to being in a forward position because of the splint-like appliances I'd been wearing for the last 9 months. This is more than enough time to allow for significant changes in the discs of my jaw joints. Going back to the email, I asked, with my lower jaw forward, my back teeth don't exactly fit together, but I'm assuming that's not a problem? Little did I know, this naive question was the first sign that something was wrong. He said, if you close your teeth together, on your back teeth, with your appliance out of your mouth, and your front teeth are not hitting, then you should start your lower appliance. In hindsight, I now know exactly what he meant by this. As I explained earlier, he thought that I started treatment with my front teeth hitting into each other, and that this appliance he gave me was going to get rid of that interference by pushing my upper front teeth forward. So he was asking me to bite down and make sure that the interference was gone. But of course the interference was gone because it was never there to begin with. But at the time I had no clue. So I did what he asked. I pulled my lower jaw back so my teeth were in proper occlusion, molars all fitting together, and of course my front teeth were not hitting because they never were in the first place. So I started the lower appliance and let him know. It's really sad looking back at all of this, knowing what I know now. But anyway, Dr. Heng told me that everything was going according to plan. I was confident, and I trusted him completely. In March 2019, I started having some issues with the lower appliance. I sent him this email. I explained that I was experiencing acute pain in my teeth and had a big sore that had developed in the bottom of my mouth. Then I asked, are my teeth actually moving forward in my gums, or do they just flare outward? I still didn't know much about teeth or jaws, but I was beginning to question whether pushing my teeth forward like this was a good idea. I used the word gums in this email because I thought that's all there was. I didn't know that there was bone, which really shows how uninformed I was. He said, the teeth and gums will move forward as you do this. Occasionally we get some very minor recession of the gums, but generally we don't get that. If you see the gums receding, that would be a reason to not continue, but I really don't expect that. He also gave some instructions on how to address the sore. I replied to him a few days later, expressing further concern about the sores. This time I included a picture. I said, I want to get this done in a reasonable amount of time, and I can put up with pain, but this doesn't really seem right. He said, getting a sore like this on the lower is not common, but it's not uncommon either. I don't want this to be a painful thing. It should not be. Despite all these difficulties, I persisted. After filing down the appliances and letting the sore heal, according to Dr. Hang's instructions, I continued using both appliances. Even though my teeth were hurting a lot, my jaw felt significantly better, and that's what I was seeking treatment for, so I figured it was all going to be worth it in the end. In May 2019, I reached the end of the screw on my upper appliance, so I sent some pictures to him. He said, "You've done a perfect job wearing the appliances, and they're working as they should." He said to call and schedule an appointment to get my second set of appliances. So I did that. I got the new appliances, and then in September, I reached the end of the screw on the second set of appliances and was ready for braces. I sent him these pictures, and he said, "You've earned a gold star for wearing your appliances and getting the spaces opened. Thanks for doing what I instructed. Not everyone does." So then I flew out to Dr. Hang's office and got the braces on. Almost immediately, my symptoms started coming back. This was my fourth set of braces, though, and I knew that sometimes things get worse before they get better, so I figured I'd give it some time to see if maybe my jaws were just adjusting. In the meantime, I'd been doing myofunctional therapy at the Breathe Institute, who Dr. Hang referred me to. The goal of myofunctional therapy was to prepare me for a tongue tie release. Here is the referral letter, which was sent to Dr. Zoggy at the beginning of my treatment with Dr. Hang. In the letter, Dr. Hang mentions that I had condylar degeneration, but said, "I don't think this will be an issue for her," despite the fact that I was getting his treatment because I was already experiencing TMJ issues. Dr. Zoggy's treatment notes also corroborate my initial complaints. It says facial pain, headaches, facial, neck, and shoulder tension, TMJ issues, and he notes that I have TMJ clicking. Throughout my treatment so far, I had started doing my own research on the orthodontic profession as a whole. Considering my history, I was very strongly against extraction retraction orthodontics, as it's called, and I wanted to do something about it. I started a website, and I was even considering a career in orthodontics or research. I decided to ask Dr. Hang what he thought, since he was such a big name in his field, and he might be able to answer my questions. Looking back on this email is kind of uncomfortable, honestly, because I was so naive, and I had no clue what I was getting myself into. This was his reply. At the end of his email, he asked if I could go to lunch with him and his wife the next time I came to LA, so we could talk all about orthodontics. I was really excited and honored that he was willing to do this, so of course I said yes. By the time my next appointment rolled around, it was clear that my jaws weren't just adjusting. So I told Dr. Hang that my lower jaw felt trapped again. Basically, I was back exactly where I was when I began his treatment. He thanked me for letting him know and said that some minor adjustments would fix it. He quickly moved on after I brought this up. Considering we were about to go out to lunch, I figured that I should just leave it at that. Interestingly, there's no mention of this conversation in his treatment notes. Then we went to lunch. He told me all about the orthodontic profession and the people in it. It was a very interesting conversation, and it was the beginning of kind of a mentorship. After that lunch is also when I got my tongue tie released at the Breathe Institute. That was by far the best dental-related procedure I've had. Dr. Zoggy was great to work with. His whole team was so nice, and I'm really grateful that I was able to have this procedure done with them. My next appointment with Dr. Hang was scheduled for February 2020. In the meantime, all of my symptoms still remained. Whatever adjustments Dr. Hang had made clearly hadn't worked. Between my appointments in November 2019 and February 2020, I also started having noticeable gum recession on my lower left second premolar. I personally didn't notice the recession at the time, but Dr. Hang, being my orthodontist, should have. I did notice a lot of pain and sensitivity on and around this tooth, but I thought it was just from the braces and all the tooth movement that was happening, and I had never experienced periodontal issues before, so that wasn't something that I thought to check for. At this point, he should have stopped treatment, or at the very least, he should have mentioned to me that my gums were receding. But he didn't. He didn't even mention it in his treatment notes. Dr. Heng had previously stated that if you see the gums receding, that would be a reason to not continue. This shows that he acknowledges the importance of stopping treatment if gum recession starts. But he didn't stop my treatment. I would give him several opportunities over the next months to stop the treatment, but he kept going. Since I was still interested in joining the orthodontic field, I emailed Dr. Heng the night before my next appointment and asked if I could shadow him. He said no, but invited me to an orthotropics mini residency he was giving in LA instead. Unfortunately, I couldn't go, but I really wanted to make sure that I had time to talk to him at my appointment because I was still having symptoms and I wanted to know what his plan was. So I asked if he had extra time during my appointment to talk about my treatment. I went to this appointment the next day and told Dr. Heng that my lower jaw still felt trapped. I asked how he was planning to proceed. He took me into his office and started showing me PowerPoint slides he'd made that documented his previous patients' treatments. I was kind of confused why he was showing me this, but I didn't know what to say, so I just sat there and listened. He scrolled through all these slides, telling me how bad these patients had it, and how good I had it in comparison. He concluded by saying that my problems were so small in comparison to his other patients, and that I should just be happy with the aesthetic improvements he'd given me so far. I was so confused, because I had told him that my symptoms had come back, and now he was telling me to be happy with what I had? I was right back to square one, with the same kind of pain I had when I first stepped into his office over a year ago. Why didn't he tell me to be happy with what I had when he agreed to take me on as a patient? Why did he decide to reopen my extraction spaces if my problems weren't that bad? I was also confused because it was like he was ignoring all the physical symptoms I was having. He kept focusing on how much better I looked, which was basically just how much fuller my lips were because my teeth were being pushed forward. But he was ignoring my TMJ issues, which is what I sought treatment with him for in the first place. This was a very disorienting conversation, and in hindsight, it seems like a very manipulative one too. Dr. Heng told me he had to go to his next appointment, ushered me out of his office, and I left. The whole way on the plane home, I was replaying this interaction in my head, trying to understand what had just happened. Now, admittedly, Dr. Heng was really intimidating to me, his wife as well, so whenever I was alone with them, I found it hard to speak up for myself. I was also still a teenager when I started this treatment, and I was attending these appointments alone. So I was both very naive, and I also had no one else there to help me navigate this treatment and learn how to advocate for myself. I'm sure if someone else had been at these appointments with me, they either would have called Dr. Heng out on what he was doing, or at the very least, they could have assured me that the evasive, often contradictory things he was telling me weren't just in my head. But unfortunately, that's not how things went. I was attending my appointments alone, and I feel like Dr. Heng took advantage of that. My confusion was unending, but I didn't know what to do about it. Then, in March 2020, my next appointment was indefinitely canceled due to COVID. During the months that I couldn't get an appointment, my symptoms were getting worse. I started experiencing more acute pain in my jaws, whereas my main problem with my jaw feeling trapped is the pressure and inflamed, achy kind of pain in my jaws. But now I was getting sharp, ow kind of pain. The clicking was now happening on both sides, and any time I would yawn, it felt like my jaw was almost getting dislocated. At this point, I was also spending nearly every part of each day researching orthodontics, learning about teeth and jaw problems, and this is when I was pretty active online. This was also when I started to suspect that Dr. Heng's treatment wasn't all it was cracked up to be. I still didn't know about the complications that could come from his treatment, but I started to see that my teeth weren't the problem. My molars were in occlusion before starting this treatment, yet my lower jaw felt trapped, which indicated that it was my jaws themselves that needed to move forward. So I finally decided to consider alternative treatment plans and see if I could get him to agree to one of those instead. That way, at least I'd have a clear plan and a treatment that made more sense for my situation. I knew that the jaws could be moved forward through surgery, but I also knew that Dr. Heng was trained in orthotropics, which aims to grow the jaws forward through proper posture. Now, this treatment's usually done in children, but I didn't want to immediately resort to something as invasive as jaw surgery, so I thought this was at least worth a shot. I've been speaking with the Muse at this point, who are the creators of orthotropics, and they brought up the idea of trying a BioBlock Stage 3 appliance, which doesn't move your teeth at all. Instead, it trains you to keep your teeth together by poking into your gums if you open your mouth, which sounds kind of barbaric, but considering the kinds of orthodontic appliances and crazy tooth movements I'd had at this point, a poke in the gums didn't seem too bad. I was well aware that this treatment was experimental, but this was the best and least invasive idea I knew of, and I at least wanted to be doing something that had a chance of working, instead of sticking with Dr. Heng's treatment, which didn't even make sense at this point and just wasn't going to work no matter what. In May 2020, I emailed Dr. Heng and asked to speak with him over the phone. We talked for a while, and I told him about this idea. But during this phone call is where I started making a big mistake. See, I didn't want to upset him, and I figured that straight up telling him his treatment wasn't working and I wanted to do something different would probably not go over well. So, I tried to cushion the anger using the sandwich method, which is where you sandwich your complaint between compliments. The only thing that was going well so far in this treatment was that I had more lip support from my teeth being pushed forward, and because of that, I thought I looked better. And from my previous discussions with him, Dr. Heng seemed to really want me to understand that I looked better and that I should be grateful for that. So I told him during this conversation that I was happy with the way I looked. And then after I established that good thing, I jumped into the reason for the conversation, which is that my jaw was still trapped. He wrote about this conversation in my treatment notes, and you can kind of see my sandwich idea in action, but I guess he mainly paid attention to the bread in my metaphorical sandwich, since he seemed to cling on to me saying I was happy with my looks, and minimize the part where I said I was still having physical symptoms. He says that I was feeling trapped a bit, but I wasn't feeling trapped a bit, I was feeling completely trapped, just like I did when I first started his treatment. But anyway, I had this phone call with him, and I thought I presented a compelling case, but he didn't seem too convinced on my idea. He kept telling me that orthotropics was just myofunctional therapy, even though I was very specifically asking for an appliance. I was also confused because I'd already been doing myofunctional therapy for over 6 months at that point, at his own request. He assured me that it would only take some minor adjustments to allow my lower jaw to come forward. He said he might push my lower front teeth back and my upper front teeth further forward, but from what I can tell, this was only going to make more of an overjet, so I didn't understand how he thought this would accomplish anything. I was still in pain, and I wanted him to give me a clear treatment plan that actually made sense, so I came up with another idea. This time, though, I very clearly typed my idea up into a presentation to send to him. By this point, I had also caught on that he thought my upper and lower front teeth were hitting into each other, so I tried to make it very clear that it was my molars that were the problem, and just moving my front teeth around wasn't going to do anything. Here is the presentation that I sent him. Again, I tried so hard to make this as clear as possible. I know the trapped lower jaw that I'm experiencing is difficult to understand if you haven't personally experienced it, but I really feel like I described it pretty well in this presentation. So I showed 2 pictures. The first, I say this is where my teeth bite together, and I have to force my lower jaw back. So my teeth are in occlusion in the left picture. In the right-hand picture, my lower jaw has moved forward a bit. And looking back, I probably should have added some lines to emphasize the difference, but regardless, I said, with my jaw in a comfortable forward position, my teeth are no longer in occlusion. And then I had an arrow to the left saying, my lower jaw feels more comfortable forward. Then I showed a different angle, so you could see my molars better. In the picture on the left, I said, my lower jaw is forced back to occlude, then on the right, my lower jaw is forward. And so I said, when I let my lower jaw come forward to where it's comfortable, my molars don't meet. So why is my lower jaw still too far back if I just reopen my extraction spaces? Well, in looking at my original orthodontic pictures, I think I figured out why. Now, this is where I made a big mistake, because I thought I figured out why, but I thought wrong. So I explained that I had large extraction spaces on top, but no space to close on the bottom. And so when my orthodontist closed my extraction spaces, there was more space to close on the top, and that disproportionate closure forced my lower jaw back. But I was totally wrong about this, because my canines hadn't come in yet in these pictures. Those spaces were never closed, because my canines came in and filled in the gaps within the next year or so. I didn't know this, because as much research as I'd done at that point, I'm still not a dental professional, but Dr. Heng is. In his response to this presentation, he said that I described exactly why my lower jaw was trapped, which, of course, was not correct. So this was very unfortunate, because I was making this presentation to try and convince Dr. Heng that he was wrong, but I ended up making him more confident that he was right. So that sucks. But even though I messed up on this slide, the rest of my presentation is still valid. So here, I continue by saying that I never should have had both my upper and lower spaces opened. I just needed my entire upper arch brought forward, which was true, mechanically speaking. So I asked how to do this, and I drew this picture showing where I'm at currently. Now, you'd think that if incisal interference was my main concern, I would have included that in this drawing. But instead, my upper and lower front teeth are very clearly not touching in the drawing. And I also pointed out jaw pain, signified by the word ouch, which I think speaks for itself. I said, "You suggested bringing my front teeth forward, but won't that just create more overjet? If my back teeth are already in occlusion, then in order to move my entire bite and jaw forward, we'd need to move the molars." So here is my idea. I said, close my reopened extraction spaces, but in opposite directions. Pull the lower front teeth back and close the upper gaps by bringing my upper molars forward, making the end result as if we only moved my upper arch forward. And on the next slide, I drew what this hypothetical closing of spaces in opposite directions would look like. And then I drew my lower jaw moving forward. I said, now my lower jaw can come forward and my molars will fit together. And I also wrote that now my jaw joint is in a good position. Next, I mentioned some specifics for how to accomplish this, possibly using reverse pull headgear on top and power chains on the bottom. But I wanted to tread lightly with this, because I know it's sketchy for a patient to get so involved in their treatment. I didn't want to upset him by telling him how to do his job, so I tried just throwing these ideas out there, and then saying, of course, the exact mechanics of how this would work is your domain. I wanted to make it clear that the ultimate decision was still up to him. That way he didn't feel like he was getting bossed around. I said, I just know that my lower jaw needs to move forward at least a few millimeters while maintaining proper occlusion. And this is my idea as for how to accomplish that. Here's his response to my presentation. He says, I described exactly why my lower jaw was trapped. But, of course, I was totally wrong about that, because my canines hadn't come in yet. But anyway, he apologized for not being clear about what he had planned. But then he still didn't clarify anything. He says it's important to make sure we don't trap your lower jaw again. If your lower jaw wants to be forward, we must accommodate that. But he already reopened my extraction spaces. Wasn't that what was supposed to allow my lower jaw to come forward? He asked if I was going to be in a position to travel for another appointment, and that we could discuss my ideas at that point. But I didn't want to fly all the way across the country. It would cost a lot of money for me, as well as time, just to get ignored. So I asked if we could have a plan in place before I arrived at his office. And he replied, I believe that there's a very good treatment approach to give you what you want. It isn't complicated and optimizes both aesthetics and tongue space, airway. It respects the fact that your mandible wants to be forward. It is practical and makes sense with everything I think you want. The kind of adjustments that are needed at this point to get you where you need to be are something I do in all cases when we get this far. If you can get here soon, I think you will understand. This response was kind of maddening. Like, how much more vague could he get? I was asking for a specific plan, but he didn't give me any details on what he was actually gonna do to me. And besides, if these adjustments were something that he has to do in all of his cases, why wasn't any of this mentioned to me when I first started treatment? I didn't like his vague answer, so I stood my ground and asked if I could speak with him over the phone again. The phone call was more of the same. He never gave me a real plan. He basically told me to trust him, and that he gets to this point with all his patients, and that we just need to do a few minor adjustments. His treatment note reflects this, since he still doesn't give any real detail about what he's planning in the note. I'm convinced that he didn't have a plan at all, because out of all the places to write about a patient's specific treatment plan going forward, I would think his patient's treatment notes would be the place. I was extremely frustrated at this point, but I didn't know what else to do, so I caved and scheduled an appointment. Around this time was when my website was gaining traction, and I started getting invited to speak about my extraction-retraction experience publicly, in interviews and on panels. Talking about this was really uncomfortable for me, though, because it's not like I was sharing a success story. I mean, I was still in pain, and this was an ongoing issue in my life, so it was difficult constantly dredging up all those negative feelings and then sharing it with the world. But since I was so deep in this community, and since so many of these professionals knew that I wanted a career in orthodontics, I felt a lot of pressure to speak, and I thought that I would burn a bridge if I said no. Dr. Hang and his social media manager were a couple of the professionals who reached out to me at that time. First, they wanted to interview me for Dr. Hang's social media accounts, and second, they wanted me to speak alongside Dr. Hang at the Breathe-a-thon in October 2020. I agreed to both. Speaking publicly about my experience was taking a really big toll on my mental health, but I thought this was an important topic, and I didn't want to let anyone down or burn any bridges. First was the interview for Dr. Hang's social media accounts. It didn't go well. I was expecting, an interview, but when I logged on, it was this recording studio, and the manager was sitting there behind a soundboard. He said, "Okay, I'm going to count down from 5, and then you're live." And I didn't understand what was happening, because I thought he was going to ask me questions, and I would respond. But he was just putting me on the spot to talk about what happened, and it was really uncomfortable. He didn't even really talk to me at all. I was just supposed to open up in front of this complete stranger. Honestly, it didn't seem like they cared about me or my story much at all. It just felt like I was being used for content. I tried to talk, but eventually I got way too uncomfortable and asked to end the interview, which was a bold step for me. That's absolutely not something I would usually do. But I was having a bad time, and I needed it to be over. One of the attorneys I spoke with later said that this may have been a tactic to shield Dr. Hang from professional liability down the road if my treatment went south. Specifically, an invitation to be interviewed might have been to play on my ego and make me think that I held a position of respect in his eyes, which I wouldn't want to lose, and would therefore speak favorably of him publicly, despite my very unfavorable experience with him personally. I avoided talking about Dr. Hang during the interview, though. I just explained my whole journey with orthodontics and the symptoms I was having. After that interview, his social media team sent me some clips. I, of course, didn't feel comfortable with that whole interview experience, though, so I emailed them back and asked for them not to post the clips. Then I sent the social media manager this email. I said, "Talking about my personal experience with orthodontics is very uncomfortable for me, and I need to take a break from talking about it. It's starting to get to me. So I need to respectfully decline to speak at the Breathe-a-thon on the 2nd. I'm really sorry if this makes anything difficult for you. I just need to prioritize my mental well-being." After I sent this email, I went completely dark. I took down my website, removed all my videos. I didn't want to speak publicly anymore. I didn't want to share my story. I didn't want to do any of this anymore. This whole situation was messing with my head, and I was just in a bad place. I was so confused with what was going on with my treatment, and I didn't know what was true. I was also still in pain, and I just wanted it all to stop. I ended up canceling my next appointment because I decided it was a bad idea to fly all the way across the country when I still didn't know what he was planning for me. At the end of that month, I finally reached out to him again and asked to speak with him on the phone. I figured I could try to convince him one last time. And look, I recognized that this was probably annoying him, but it's not unreasonable for a patient to want a clear treatment plan, and I wouldn't have been asking for phone calls like this if he was just upfront with me about what he was doing. In this call, I decided to ask him again about trying the BioBlock Stage 3 appliance, but this time I really practiced what I was going to tell him. That way he couldn't possibly misunderstand me. I mean, it sounds pathetic, but I literally practiced. I had lines. I did not want to be misunderstood. I wanted him to finally see that I was still in pain and I needed a real plan. He called me later that day, and we ended up having a long conversation. It started out all right. He let me speak, and I clearly explained my idea. Step 1 was to take my braces off. Step 2 is get a Stage 3 BioBlock appliance that doesn't move teeth at all to train my posture. Step 3, continue myofunctional therapy to make sure I'm keeping good posture. It was a very simple idea. All I needed was for the appliance to get made, and the rest was up to me. Dr. Heng voiced his concerns, though. After this phone call, he sent me this email, and it's basically a summary of the call, so I figure I might as well show it now. He said that in order to use the Stage 3 appliance, we'd have to push my teeth forward more, which he didn't think was a good idea to do. But I told him that the Muse, who had made these appliances, are the ones who suggested this idea to me, and they said that we wouldn't need to push my teeth forward. I could just get a Stage 3 appliance with my teeth as is. Mike even offered to work with Dr. Heng to make this appliance, but Dr. Heng appeared to ignore what I said. Before this, he was also saying that he wanted to push my teeth farther forward, but I told him I didn't think that would accomplish anything. So I already made it clear that I didn't want my teeth pushed forward more. But anyway, next he said it was a bad idea to get this appliance if I had implants to fill in my reopened extraction spaces. I told him that if I did get this appliance, I would not get implants, because my teeth would be shifting, and it's a bad idea to get implants and then let your teeth shift. I thought we were on the same page about this, so I moved on. Next, he was confused as to why I even wanted to do this. I told him it's because my jaw still felt trapped, but he seemed to ignore that. I also told him that because I wanted to do research in the orthodontic field, I could use this as a research project. Kind of be my own guinea pig. He seemed to latch onto this topic instead. He started talking about how he thought it wouldn't make any difference in the orthodontic profession for me to do a research project like this. I understood what he meant, and ultimately I agreed with him, but I still thought it would be an interesting project, especially since I didn't have any other ideas for how to fix my jaw, and I'd rather try something like this before going to surgery. But he still wasn't convinced. He told me he thought I should just finish treatment with him, because I already had such great aesthetic improvements, and I could lose all of that if I tried the Stage 3 appliance instead. He referenced this analogy about a bank robber and a penny on the sidewalk, which was basically, there's a robber, he robs a bank, and then he's running out of the bank with all the bags of money, and a penny falls out of one of the bags. But the robber's greedy, and he wants it all. So he goes back to get the penny, and then he gets caught and loses all the money. But in this analogy, Dr. Heng is referring to my aesthetic improvements as robbing the bank and getting this great reward, while fixing my jaw pain is the penny on the sidewalk, which is such a small thing that I would be greedy to try and pick it up. This is when everything fell apart, because I brought up once again that my jaw was still trapped, and the reason I was looking into all these alternative treatments was because his treatment wasn't working, and I didn't understand how he could possibly get my lower jaw to come forward just by moving my front teeth, when it was my molar relationship that needed to change. This is when he started getting upset. He told me that I looked fine, so what was I so concerned about? And so I told him that I was still in pain. That's what threw him over the edge. He yelled at me, told me that he had to go, and hung up. So later that day is when he sent this email. And it's weird because it seemed like his biggest hesitation with making me a Stage 3 appliance was that apparently we'd have to push my teeth way forward first in order for it to work. But then at the end of the email, he says that I could wear a BioBlock Stage 3 appliance after I'm done with his treatment. But that's a huge contradiction. I also think it's interesting, because if we rewind all the way to the beginning of my journey, when I first told Dr. Heng that I was interested in a career in this field, he told me that I was very calm for someone who had been victimized. But now, in this email, he's saying that this is a very emotional issue to me, which I find to be an interesting change in the way he's framing my behavior. So that was that. I ended up rescheduling for October 2020. Looking back, I obviously should have jumped ship at this point, but I wanted so badly to believe him, to believe in a cure to my jaw pain, and believe that he was helping me. I didn't want to just give up. I was afraid that if I left this treatment, I was basically resigning myself to a life of chronic pain, because I didn't know what else I would do. I thought, I need to see this through, because he really seems confident, and maybe I just don't see the full picture. At my next appointment, I once again mentioned that my jaw still felt trapped, but this time was different. As soon as I brought this up, Dr. Heng and his wife tried to end my appointment as soon as possible. It was weird. I brought up that I was in pain, and immediately they started wrapping up my appointment. It seemed like after that last phone call with him, they knew I wasn't happy with the treatment and wanted to get me out as fast as possible. Right after the treatment, though, I noticed that my whole bite was now getting propped open on my canines. I guess whatever adjustment Dr. Heng did pulled my canines down. He was trying to upright the roots of my teeth on either side of the spaces that he opened to make room for implants, and so I guess in this process of trying to upright my canines, he ended up pulling them down. Usually, I'd just put up with this until the next appointment, but my patience was wearing out at this point. I'd been ignored so many times. I didn't feel like this treatment was working. I expressed this all to him repeatedly, and now I had to deal with my canines propping my bite open? All for what? So I sent this next email. This was the most bold confrontation I had with him yet. Of course, I could only be this bold in writing. Whenever I spoke with him over the phone or in person, he was always able to intimidate me into just dropping the subject. But this email was my last attempt at making him understand. In the first paragraph of my email, I mentioned that my whole bite was being propped open on my canines, and that Dr. Heng pointed out that my canine teeth were already pretty messed up. This is in reference to the severe wear I have on my canines due to grinding my teeth during my first set of braces, when my orthodontist gave me a crossbite. Dr. Heng would frequently tell me how sad it is that my canines were so worn down, and that my teeth looked like those of a 90-year-old woman. In my second paragraph, I pointed out that my extraction spaces had already been reopened, yet my lower jaw still felt trapped. This is important because reopening extraction spaces was supposedly what was going to untrap my lower jaw. That's what the deal was. That's what I signed up for. But now here I was, the spaces were open, and yet I was still in pain. I then said I understood that he didn't promise me anything, and that I wasn't mad at him that his treatment wasn't working. I told him that I thought I looked so much better than before, which was true at the time. I used to not have much upper lip support, and I felt that I looked better now that my teeth were farther out, which gave more support to my upper lip. But the braces masked a lot of the damage that had been done to my teeth, as well as how ridiculously flared my teeth were. So I was blissfully ignorant to how much worse I actually looked. I then said, however, if I just wanted to look better, I could have spent the $19,500 on plastic surgery. Or even easier, I could just wear copious amounts of makeup, like every other female my age. But I really don't care enough to do that. Rather, the health of my jaws is and always has been my main focus. Notice that this is not my usual style of writing. It's clear that this was my breaking point, and I was really just trying to get the point across to him once and for all. This paragraph here was not my finest moment, but I was trying to make it glaringly obvious to him that I was not getting this treatment for aesthetic reasons. Sure, maybe aesthetic improvements could be a latent effect, but I was getting this treatment because I was in pain. Plain and simple. Obviously, my statement was an overgeneralization, and looking back, I regret what I said. But just remember that this was an email between me and my orthodontist that I had no intention of ever making public. And I do think that I accomplished my goal with this statement. I mean, if my main goal was to look better, the obvious first place to begin would be with makeup. you can make yourself look very different. And then there's so much I could do with plastic surgery to improve my looks, and improve my looks way more than by pushing my teeth forward. $20,000 is a lot of money. I could have just gotten jaw surgery with that. Also, the way that I'm writing this implies that this was not my first time mentioning this to him. This whole email seems very strange if no previous conversations had occurred on this subject. I said, the health of my jaws is and always has been my main focus. The fact that I said always has been implies that this idea was being contested, which lends credibility to my claim that during our in-person and phone conversations, Dr. Heng had been telling me that I was just getting his treatment for aesthetic reasons. Why else would I have felt the need to emphasize that the health of my jaws always had been my goal? In my final paragraph, I asked him for a plan. I think it's clear from the specifics that I mentioned in this paragraph that I was asking him for a specific plan, not a vague statement, not a maybe we'll do this or maybe we'll do that. I wanted a specific plan. I can understand if a doctor doesn't want to get into specifics with a patient because they feel it goes beyond their patient's understanding, but at this point, I had more of an understanding than the average patient, and Dr. Heng knew that. I mean, he'd talked to me about orthodontics for hours, and he was perfectly fine discussing the intricate details of other patients' treatments with me. He was definitely aware that I could handle details. Also, in all of this correspondence, I had told him many times that my front teeth were not hitting prematurely and that my molars fit together, yet my lower jaw still felt trapped. But even if he somehow didn't understand me all the other times, it should have been 100% clear to him now. I wrote, my molars fit together and my front teeth were not in the way, yet my lower jaw still feels trapped. So this should have ended the idea that incisal interference was causing my problems. Then I pointed out that it was not possible to allow my lower jaw to come forward without moving my molars. This is why I was suggesting headgear, because to my knowledge, you can't get the leverage necessary to move the molars forward without forces from outside the mouth. I closed my email by once again asking for what Dr. Heng was planning, so I could either know exactly what was going on or leave the treatment and pursue something that would actually work. I was in pain. I needed help. The clicking in my joints was significantly worse at this point. All this crazy movement of my teeth had messed with my jaws so much. I didn't want to continue if this wasn't going to accomplish anything. After I sent this email, Dr. Heng called me almost immediately. He basically told me to calm down and let him do his job. And then that this happens with all of his patients, and we just needed a few more minor adjustments. The main takeaway I got from the conversation was that if my lower jaw still felt trapped at the end of treatment, Dr. Heng would do occlusal equilibration to allow my teeth to fit together where I wanted them to. I didn't know what to say, so I let the conversation end. Occlusal equilibration, to my knowledge, is a common technique used in an attempt to improve TMJ problems, where you grind down portions of the teeth to force them to fit together. But it's also a permanent change, and if it doesn't work, you can't get your real teeth back in their entirety. I very much wanted to avoid any permanent changes to my teeth, considering I already had 8 permanent teeth extracted, and I was getting this treatment to reverse the damage done to me apparently because of losing teeth. This conversation really upset me, because as I've stated before, I was under the impression that the treatment I was undergoing was reopening my extraction spaces. I pursued this treatment because Dr. Heng portrayed himself as this progressive, non-traditional orthodontist who focused on the root cause of TMJ problems, not just providing band-aid solutions. His online persona emphasized the need to preserve teeth and preserve the natural integrity of the patient's mouth. I'd already been to 2 traditional orthodontists before, who shaved parts of my teeth down. It didn't work. If I wanted to try that again, I would have. But instead, I went to Dr. Heng, because I thought he was providing some groundbreaking method that no other orthodontist did. The treatment was over. He reopened my extraction spaces, and my lower jaw didn't come forward. So the treatment didn't work. But now Dr. Heng tells me that this happens with all of his patients, and that these simple little adjustments will solve the problem. So why did I just get my teeth pushed forward like this, if the problem was ultimately going to be solved through occlusal equilibration. I could have gone to any orthodontist where I lived to get that done in a single sitting, but I'd been flying across the country and had spent tens of thousands of dollars in treatment and travel costs, all for him to tell me that we could just solve the problem by grinding parts of my teeth down? Basically, I felt like he pulled a bait and switch on me. I decided to send him a follow-up email to see if I could get him to put into writing what he told me over the phone, but it didn't really work. I suspect that he saw what I was trying to do and didn't want to get himself into trouble by putting anything specific in writing. I still wanted to know if he had a legitimate plan as to what he was going to do, but he just gave me a list of maybes. I mean, we were getting close to the end of treatment, so what was his next step? Which one of these things was he actually going to do at my next appointment? Here are the treatment notes he added after the phone call. So he says he might expand and intrude my canines to make them not prop open my bite anymore. But then farther down he says, I then addressed the feeling of mandibular entrapment and told her that I might have to retract the lower teeth slightly to get rid of premature contact. Once again, he thinks I have premature contact of my front teeth, but that's not the problem. I even stated in my email that my front teeth were not hitting prematurely. My canines were, but that was a new problem and I made that clear. And he seems to have understood that because he referred to my canines separately in these notes. See, canines were the first topic, and then the mandibular entrapment was second. Again, I stated in my email that my molars fit together and my front teeth were not in the way, yet my lower jaw still feels trapped. It seemed like no matter how many times I told him otherwise, there was no convincing him that my issues weren't caused by my front teeth hitting into each other. At this point, I gave up. I tried so many times now to communicate with him, and it seemed clear to me that he was either incompetent or he was willfully ignoring me. And look, I'm aware that doctors don't really like patients telling them what to do and getting so involved in their treatment. But I didn't start questioning him until it was clear that his treatment wasn't working and was actually making things worse. It's not like I came into the treatment skeptical of him. If anything, I should have asked more questions at the beginning. Instead, I just jumped in head first. I told him my symptoms and then trusted him to do his job. So even though I'm sure I was annoying him at this point by asking so many questions, I was a very nice, respectful patient. And my questions were not unreasonable. Having a treatment plan is a requirement for any healthcare provider once a diagnosis has been made. And my family was paying this guy tens of thousands of dollars. So really, I don't think my behavior was unwarranted. But regardless, at this point I decided to just be quiet and wait for everything to work out like he seemed so certain things would. I thought, maybe I was being too pushy. Maybe I was asking too many questions. So I'll just stop mentioning my jaw issues and let him finish this. I'd made it clear enough to him that I was still having symptoms and that, having mentioned this countless times now, he would continue to do his little adjustments to fix it. So yeah, I don't really have any emails with him after this. The only email I sent him regarding my treatment was because one of my wires broke, and I wanted to check if there was anything he wanted me to do. But other than that, I just went to my appointments, let him adjust my braces, and left. I didn't bring up my jaw problems at all. The one thing I did bring up at my appointments was that my canines were propping my bite open. But I figured this was an innocuous thing to bring up, because Dr. Heng himself said that they should be pushed up, and he even seemed enthusiastic about doing this, since he explained this whole idea he had to push my canines upward and then refer me to a prosthodontist to get my canines rebuilt because they were so worn. And I said that sounded great, so it seemed like we were in agreement about this. So at my next appointment in February, I mentioned that my canines were still propping my bite open, and he said he would do some adjustments to push them up. My February appointment passed, and my canines were still propping my bite open. So at my next appointment, in March, I again mentioned that my canines were propping my bite open, and he said again that he would do some adjustments to push them up. But even after this next adjustment, my canines were still propping my bite open. When I arrived at my next appointment in May, Dr. Heng told me he had good news, and that I could get my braces off at my next appointment. I was kind of stunned. Not only did he leave my bite propped open on my canines, but he didn't do anything to address my jaw problems, as he assured me he would. As soon as I stopped mentioning it at every appointment, I guess he assumed my problems magically disappeared? I was trying to give him space and show that I trusted him and respected him as a doctor, because he seemed to get upset when I mentioned that my jaw still felt trapped. But then I stopped mentioning it, and he just didn't do anything. Should I have kept asking him about my jaw? I don't know. I don't understand what I was supposed to do. But regardless, you'd think a decent doctor would have at least asked me whether or not my jaw felt better before saying I was ready to get my braces off. Dr. Heng told me he was confident that he could make this treatment work for me. He kept dragging me on and on, making me believe that maybe I just didn't understand his treatment after all, and there really was some fix to all of this. But no, there never was a fix. I don't think Dr. Heng ever had a plan. And maybe you're wondering if he did try to do adjustments to entrap my lower jaw. But this isn't mentioned anywhere in his treatment notes. I assume that if he made adjustments like that, those would have been worth writing down. And regardless, it was his job to accurately record any adjustments in my chart. I also think it's fair to say that since I'd been experiencing these jaw problems for years now, the problem wouldn't just magically disappear without him actually doing something substantial to cause that kind of change, in which case he would have written down what he did in his treatment notes. All he talks about in his notes is getting enough space for implants. He did mention here that I told him I wasn't going to get implants for a while, which was true. I made this comment because I recognized that he was only focusing on getting my spaces open for implants. But I didn't care about implants, because they were mainly an aesthetic matter, and that was never my goal in the first place. Dr. Heng is the one who suggested implants to me. I didn't come to him saying that I wanted implants. No, I wanted him to focus on my jaw pain. But either way, why would I get implants if my jaws still didn't feel right? Implants are the final step, but he hadn't even fixed my main problem. At my next 2 appointments, he still doesn't mention making any adjustments to relieve my pain. All of his notes are, again, related to opening my spaces enough for implants. He doesn't mention retracting my lower front teeth to get rid of premature contact, as he said he would in my previous treatment notes. It's like he forgot that my lower jaw was trapped at all. Here are my treatment notes from March 2021. He says that I wanted him to move my canines labially, but I only ever asked him to push them up, and to my knowledge, labial movement means expanding them farther out toward the lips, so in this case, flaring them out. And that's not what I wanted. I don't think anyone would want that. And besides, flaring them out wouldn't help us to rebuild them like he told me we were going to do. So this comment really doesn't make sense. I personally suspect that he saw my canines were starting to look weird and tried to pin it on me by making it seem like that's what I wanted. Also, he'd said in previous emails and conversations that he didn't feel comfortable moving my front teeth any farther forward, and now here he was, pushing my canines farther forward. The fact that he pushed my canines farther forward means that he was okay with that in the end. Or maybe he accidentally pushed them forward. I don't know which it is, but either way, this is another contradiction, and he is ultimately responsible for where they ended up, accident or not. In this final note, he says that I had no pain or discomfort, but nothing he wrote in his previous notes suggests that he did anything to fix these problems. All he did was continue to move my roots apart for implants. He didn't make any adjustments to entrap my jaw. He didn't even mention my jaw problems at all. I had told him that my lower jaw needed to move at least a few millimeters forward for me to feel better. But between these appointments, it doesn't look like my lower jaw moved at all. And it certainly didn't move forward by 3+ millimeters. So Dr. Heng is claiming that I told him my pain went away. But what did he do to make that happen? Nothing. I've come to believe that all his talk of making some adjustments was just a tactic to stall and try to wear me down, which unfortunately worked because I believed him, and as a result, I stopped questioning him. But going back to that appointment in May, after he said I could get my braces off, I told him that my canines were still propping my bite open, Suddenly, the story changed. Suddenly, his whole plan of pushing my canines up and rebuilding them disappeared. He told me that I didn't actually need to get my canines pushed up. Instead, he could just reshape them. I was bamboozled at this point. He told me so many times how bad the wear on my canines was. And now he claims that they never needed to get pushed up at all, and that we could just grind them down even more. He pulled out the dental drill and told me it would be super quick, and the problem would be solved. I was horrified. I told him, no, not right now, because that's a permanent decision. He said okay, and sent me up to the front desk to get me scheduled to remove my braces. I didn't know what to do. He was seriously going to grind off parts of my already severely worn canines, right then and there. I was done. I did not want to be his patient anymore. Whenever I brought up my concerns, he either ignored me or tried to convince me it was never a problem in the first place. I needed to end the treatment, because I was afraid that if I stuck around, he would waste more of my time and money, or worse, he might damage my teeth, which had already happened at this point. I just didn't know it yet. I was still in pain, but I knew that even if I told him I was still in pain, he'd just ignore me, and this treatment would drag on for even longer, with no resolution. I figured that this was just a dead end, and I needed to move on, so I let him end the treatment. I went to my next appointment in June. This was actually a series of 2 appointments. At the first appointment, I was supposed to get my impressions for the retainers, and then get the braces taken off and retainers fitted at my second appointment the next day. He told me that this was because my teeth would start moving backward immediately after taking the braces off, so we had to be quick. But when I got there, he told me that they were actually going to take my braces off at my first appointment and then fit me for the retainer the next day. His contradictions seemed insane. But again, I didn't know what to do, so I just went with it. When I came back from my appointment the next day, I basically just said hi, sat down in the chair, and then I left. He did ask if I would take a picture with him before leaving, which I agreed to, because saying no would make things weird. So I did that, but I never received a copy of the picture. Dr. Heng never asked if I was pleased with the results from his treatment, if I liked the way I looked, or if I was still in pain. I left the office, asked for my final gallery, and that was that. Here is my final gallery. This is comically bad. If we compare this to where I started, this is not a good result. My canines are twisted and protruding outward. Canines are not supposed to stick out like this. You can see it in this picture too. My teeth are not in a proper arch shape. And then the gum recession. This is just bare root exposed. And then on the other side too. And on my canines. And it's really painful and sensitive. You can see that my lower second premolars have been pushed out of the bone. My teeth don't even fit together anymore. And this is because, of course, my canines have been pulled down, so they're propping my bite open, but also my upper and lower second premolars are twisted, and then all of my molars are stair-stepped. This doesn't even show the damage to my teeth and jaws themselves. They even gave a subtle acknowledgement that my canines were sticking out when they replied after I asked for my final gallery. Dr. Heng's wife, Debbie, said, "We'll be eager to see you with the implants. It will round out the appearance of the upper arch especially. This acknowledges that my canines are not in line with the curve of my arch. But even if I got implants, that wouldn't mask how my canines are sticking out beyond my lower lip." When I got home from getting my braces off, I looked in the mirror and was honestly shocked. I thought at the very least I was going to look better from this procedure because I had more lip support now. But as soon as the braces were off, it became clear just how weird my teeth look. My canines are getting stuck on my lips, and anytime I smile, my upper front teeth overlap my bottom lip. It looks really weird. Even with the retainer with fake teeth in it, it still didn't look right. But at this point, all I thought was wrong was that my jaw problems didn't get fixed, my teeth looked wacky, and my bite was worse than before. I didn't think that any irreversible damage had been done. Dr. Heng never mentioned anything going wrong during the course of treatment, and I didn't know anything about periodontics, so I never thought to look. In fact, I'd hardly been looking at my teeth at all until I got the braces off. I couldn't see a lot of my teeth anyway, since I had brackets and these huge springs in my mouth blocking a lot of the view. I was experiencing a lot of discomfort with my teeth at this point, but I didn't think anything of it because I assumed it was just because of the braces. For example, my gums were inflamed, my teeth were really sensitive, and my front teeth were wiggly. Again, I assumed that all would go away once the braces were off and my teeth had a chance to settle, so I didn't really think anything was wrong. Here are some screenshots of a text conversation I had with my fiance right after getting my braces off. This was a very informal conversation, and I wasn't having the best day, but I hope this lends some more credibility to the claims I'm making. So he asked if it was nice to have the braces off, and I said yes, but my teeth are a little yikes. It's not the end of the world, but this isn't my best look. And I said the braces kind of masked how much my teeth were sticking out, but it's pretty dorky looking. He just gave me a ridiculous overbite. Again, it's not the end of the world, but the aesthetic results were pretty much all I was looking forward to since my jaw pain wasn't fixed from this. But now I see my teeth, and they're just weird looking, so I pretty much got nothing out of this. I mentioned that Dr. Heng thinks my result is perfect, and there's no convincing him. I said if I told him again that my bite still wasn't right, and tried to get my money back, it wouldn't work, because he would just claim he never got a chance to finish the treatment, since I wouldn't let him shave down my canines. Then I started sending pictures. And you can watch me go through several stages of grief the more I looked at my teeth. I said I would try to do a cheesy smile so my upper teeth wouldn't touch my bottom lip, and that didn't help. I took this picture from farther back to see if maybe being close up was just distorting things, and yeah, it still didn't look right. I said I was going to stop looking at it and hope that the retainer with fake teeth would make it look normal. Then I mentioned that I told Dr. Heng to push my canines up, but he kept saying we'll shave them down. And then we reached the depression stage. I said, I just want this to be over. I just want to look like a normal person, and I never want to get near an orthodontist again. Here are my first and last pictures taken by Dr. Heng. At first glance, it looks like there's been improvement. My upper lip is fuller, and my smile looks bigger. And these were the pictures I was basing my results off of. The majority of my treatment took place during COVID. I didn't go out and get my picture taken, and I wasn't using social media at that point, so I wasn't taking selfies or anything. So these pictures were all I was looking at. And so I was really convinced that I looked so much better. But Dr. Heng's photos don't tell the whole story. Here's a picture I took a few months after the treatment ended. My teeth look ridiculous. I understand that anyone would look weird with missing teeth, but even if I had implants to fill in the gaps, my canines are still sticking out over my lower lip, and my front teeth look huge. This is not normal. He also messed up my smile arc. The smile arc refers to how your upper teeth align in relation to your lower lip. The goal for orthodontists is to have the upper teeth follow the natural curve of the lower lip. This is consistently considered the most attractive and ideal smile. However, by pulling my canines down, Dr. Heng didn't just flatten my smile arc, he inverted it, which is associated with an aged and less attractive appearance. I don't know how in the world Dr. Heng sees this result as acceptable, let alone good. Here is a comparison between the final picture Dr. Heng took of me and the picture I took. My teeth are in the same position in both of these pictures, yet I look significantly weirder in the second one. Some small changes in lighting and camera angle makes all the difference. Dr. Heng takes his pictures with a flash and using a zoom lens, while standing in the doorway across the room, whereas the picture on the right was taken with the ceiling light on, using a regular camera and a normal length lens, which gives a more realistic image of what I actually look like if you were to see me in person. Of course, I can't claim that he takes his photos the way he does, specifically to mask weird-looking teeth, but I can say that the photos he takes don't show what his patients actually look like. In the referral note he wrote at the beginning of my treatment, he said, "She's a pretty girl, but will be much better off when we get her teeth and lips back where they were meant to be." Does he really believe I look better now? Sure, maybe my teeth were meant to be farther forward in my face, but only if my entire upper jaw was farther forward too. Just pushing my upper front teeth forward, without moving my bone structure forward too, was bound to make me look weird. Unfortunately, I realized that too late. But Dr. Hang, being the expert, should have known this from the beginning. So I kept telling him throughout this treatment that I didn't care about the way that I looked. But I kinda do now. I never used to think about the way my teeth looked. That wasn't a problem for me. But now, I'm in what's supposed to be the peak of my youth, and I have horse teeth. It just sucks to have paid so much for a treatment and be left looking like this. A few weeks after he took my braces off, a group of dentists and orthodontists reached out to me asking if they could look at the results from my treatment. When I was working on my website and videos, I spoke with lots of different doctors about my case, so of course, they were interested to see how it turned out. So I said sure. The doctors reviewed my files and told me that my mouth had been seriously damaged. They said that my teeth had been pushed out of the bone, so I was at risk for tooth loss. I also had gum recession and would likely need gum grafts. But they said that gum recession from orthodontics doesn't usually start to appear until years after the treatment concludes. So the fact that I had such apparent recession right at the end of treatment was a big problem. I didn't really believe them at first, to be honest. It was a mixture of being fed up with the whole situation and also not knowing anything about periodontal issues. I decided to research gum recession and why it was so bad, because up until that point, I thought it was just an aesthetic issue, and I didn't understand why it was such a big deal. That's when I learned that gum recession can lead to pain, decay, and tooth loss. But why would I have agreed to a treatment that could damage the integrity of my mouth and lead to me losing teeth if the whole point of his treatment was supposedly to fix the issues I had as a result of structural damage and tooth loss in the first place? To me, it seems like Dr. Hang exploited the trust that I had in him as my healthcare provider by telling me that gum recession wasn't a big deal. And as a result, I didn't research it before agreeing to his treatment, which meant that I didn't make a truly informed decision on whether or not that was something I was willing to risk. I decided to give it some time to see if my teeth would feel better. Who knows? Maybe these doctors were wrong. Maybe all I needed was to let my teeth settle, and all the inflammation and pain in my mouth would go away. But unfortunately, my symptoms did not go away, and the realization started to set in that this was serious. I tried reaching out to local orthodontists, but I kept getting turned away because they didn't know what to do for me. I had one doctor turn me away without even doing a consultation because I sent him my records, and he knew right off the bat that he didn't feel comfortable working with such severe jaw issues. Another agreed to a consultation, but he ended it within a few minutes because after looking at me in person, he also didn't feel comfortable moving forward. I eventually did find an orthodontist who agreed to provide a very conservative Invisalign treatment to bring my canines in a little and level out my bite, but he later revoked his treatment plan and said that he thought about it a little more, and I really needed a more comprehensive treatment beyond what he could provide. He recommended that I reach out to a team of doctors at a university out of state. I even reached out to a jaw surgeon, but he said he couldn't even begin to help me until my bite was fixed. All of the doctors I consulted with were very kind to me, and I really respect that they acknowledged they couldn't help me and turned me away instead of dragging me into another treatment. I really am grateful for that. But ultimately, I felt really alone and hopeless. I was already dealing with the jaw pain, but now I had this whole new set of problems, and I honestly didn't cope well with it. The sagittal appliances Dr. Hang originally had me use stair-stepped my molars, so now food keeps getting stuck in between my teeth. This is uncomfortable because of all the pressure from the food pushing on my teeth, but the bigger issue is that it makes it really difficult to keep my teeth clean. I have to floss all throughout the day now, and it's not a simple process either. I have to fish out the food because the gaps are so big, and it's honestly disgusting. Then I started developing all this redness and inflammation around my teeth, and I decided to see a dentist about it. The office I went to has a couple of different head dentists, so I was evaluated by both of them. And as with everyone else before them, they were so confused with what Dr. Hang did. but they were very nice, and they gave me a bunch of tools to help me clean in between my molars better, and also this prescription anti-gingivitis mouthwash. All of this has been helpful, but it's really time-consuming, and if I stop doing these things, the problems will just continue to progress. Another issue is that my teeth are super sensitive, especially in the spots with gum recession. It's painful to brush over them, which only makes the problem worse. I've been using sensitive toothpaste, and I get these special sensitivity treatments at the dentist's office, but it only works for a few weeks, so it's not a permanent solution. I also have a lot of weird tooth pain now. Like, biting into hard food hurts, which was not the case before this treatment. I also keep hitting utensils into my front teeth. I assume because they're in such an unnatural position, and my brain isn't used to it. And I've been getting random shooting pain through my front teeth, and then these spontaneous mouth bleeds, where I'll just bite into something, and suddenly my mouth is filled with blood. So not only does my jaw hurt even worse than before this treatment, now my entire mouth hurts as well. I was wearing the retainer Dr. Hang gave me until November 2021, but every time I would take my retainer out, my teeth would begin to move backward. So then, when I'd put the retainer back in, my teeth would shift forward again. And this back and forth movement of my teeth seemed like a really bad idea since my teeth were already wiggly and had apparently been pushed out of the bone. So I decided to stop wearing the retainers. I figured maybe this would give my teeth a chance to settle, and maybe my front teeth could move back a little bit too and not look so weird. But that didn't really accomplish much. My teeth didn't move very much, so I still have gaps. The food still gets stuck between my teeth, and my teeth still hurt. See, I had managed to convince myself that this whole problem would go away if I just let my teeth settle. But I quickly realized that this was not the case, and that permanent damage had been done. And this has been difficult to accept. I hopefully have many years ahead of me in life, and I'm honestly concerned, not just about how this will look as more time progresses, but I'm also concerned about my long-term health and function as I get older. But in the meantime, I knew I needed to move forward, so I asked my dentist if they could help me fill in the gaps in my teeth somehow. They tried a couple different things. First was Invisalign-style retainers with fake teeth, but that was only a temporary solution. Ultimately, they suggested partial dentures, and I was really hesitant about this, not only because of how expensive they would be, but also because dentures? Really? I mean, it's not the end of the world, but there's a certain connotation with dentures for anyone, let alone someone in their 20s. And it just sucks. But they were right. That was the best solution, so I agreed. Unfortunately, insurance wouldn't cover any of it, so that was too bad. But I know that this is just what I have to do now, and I'm grateful to at least have something to fill in the gaps. And I have to say, my dentist did an amazing job making these dentures look as natural as possible, and making them fit around my wonky canines. I've had them for 2 years now, and they're still holding up well. But the unfortunate thing is that the dentures make my inflammation problem even worse, because the parts that wrap around my teeth trap even more food. I have to go to the bathroom at work, take my teeth out, and floss out the chunks of food, otherwise it gets really uncomfortable, and it also increases my risk of tooth decay. And because of this, I don't really like wearing the dentures. I'd prefer not to. But then, it's embarrassing not to wear them. And if I forget to wear them, I avoid people, and I avoid smiling. Actually, a few days ago, I was in my car trying to clean out my teeth before an appointment, and I accidentally dropped one of my dentures under the seat. I searched everywhere, but I couldn't find it. It just disappeared. And I was so sad. I just started sobbing in the parking lot. I felt so ashamed by how much I rely on these dentures to feel normal. How these stupid gaps in my smile have so much power over me. I ended up going to the appointment without the tooth, which was not cool. I did end up getting the denture back later that day. It turns out that they fell into an air vent. But, the gaps and the dentures are this whole new thing that I have to deal with. And I didn't sign up for this. I mean, I was supposed to get implants, but I'm not eligible for implants because I need so much more orthodontic treatment now. But going back, I finally decided to see a periodontist, and they recommended a gum graft as soon as possible. And I really didn't want that. I searched online for any other way. I didn't want a surgery. I didn't want more things done to me. But there's nothing. Not for acute gum recession like I have. So I agreed to the surgery, and it was not a good experience. Because I didn't go under for it, so I just had to lay there while they peeled my gums off and then cut out some of the roof of my mouth and sewed it back onto where my gums used to be. And it wasn't fun sitting through that, especially because I knew what they were doing. And it was also sad because I've always taken really good care of my teeth and mouth, and knowing that they were just destroying my gums, it just sucked. Even though I know my gums were already messed up, but this was my first real confrontation with the fact that permanent damage had been done, and I was never going to get my healthy, natural gums back. Thankfully, the graft was successful. It didn't cover as much of the tooth as I was expecting, but it's good enough. And the tooth doesn't hurt as much anymore, which is also cool. My experience since then has been difficult, trying to figure out where to go from here, trying to find doctors who are willing to take me on as a patient after all of this. And I don't blame them. I mean, who would want the liability of taking on a disaster case? But at the same time, even if I can find a doctor to help me, I don't know if I can agree to another round of treatment. I don't want to be in braces again. I don't want more people sticking their hands in my mouth and forcing my teeth around. I'm honestly traumatized by orthodontics, and every time I go in for another consultation, I feel like I'm on the verge of a panic attack. And the amount of trust I would have to put into another doctor to do round 5 of braces, I don't have any more trust left to give. But I want my teeth to get fixed. So now I'm caught in this catch-22. And at this point, I might just try to fix my teeth myself. But anyway, here are x-rays from before and almost the end of treatment with Dr. Hang. You can see it looks like I've had bone loss in my jaws. And then, at one of my dentist's appointments, they told me that I have invasive cervical resorption on one of my molars. And this is different from root resorption. Invasive cervical resorption is a rare disease that causes resorption on the external surface of the tooth, and it often leads to tooth loss. I requested my records from my previous dentist, and I found that the resorption of my molar didn't begin until Dr. Hang's treatment. Another issue, kind of tangential to my teeth situation, is that he gave me 6 CBCT scans throughout my treatment. I get that it's a good idea to take some x-rays when forcing teeth around like this, but Dr. Hang's purpose for taking the x-rays was to see my roots, to make sure that they were far enough apart for implants. And he only needed a panoramic x-ray for that. Eventually, I started to wonder if all these x-rays were okay, and it turns out they're really not. So when he wanted to continue taking more CBCT scans at each appointment, I told him I wanted to hold off on any more x-rays. I likely would have ended up with a total of 7 or 8 CBCT scans by the end of treatment if I hadn't started saying no. In the ADA's guidelines on the use of CBCT, they say clinicians should perform radiographic imaging only after professional justification that the potential clinical benefits will outweigh the risks associated with exposure to ionizing radiation. The CBCT scans were being used to check that my roots were far enough apart for implants, simply to fill in the large gaps that had been created in my mouth. The implants weren't going to help my jaw feel better, my jaw being the reason I sought treatment with Dr. Hang. Considering I was not getting his treatment for aesthetic reasons, I would argue that the benefit of getting implants did not outweigh the risks of ionizing radiation. 3 of the 6 CBCTs were taken after I reiterated to him that my number 1 priority was the health of my jaws, and that I didn't want to continue his treatment if it wasn't going to help me. I was also a pediatric patient during this treatment, which makes taking x-rays even more risky. Not only did he take all of these CBCT scans, but he also used a large field of view every time, capturing full maxillofacial images. If these x-rays were supposedly to look at my roots, he could have used a small field of view to capture only my tooth area. In my treatment notes, he even says that he was only using the panoramic function from the CBCT. He refers to it as a pan for this appointment in January, and says next appointment he would take another pan. All of these x-rays turned out to be large field of view CBCT scans, from which Dr. Heng only seemed to be looking at the panoramic view. CBCTs in general give a much higher dose of radiation than panoramic images, but between small, medium, and large field of view CBCTs, the radiation dose increases substantially. A large field of view maxillofacial CBCT has the potential to give 1.23 to 357 times more radiation than a panoramic X-ray, with a median of 3.6 to 29 times more radiation for each of the 6 scans. Considering this large potential difference in radiation dose, the use of large field of view CBCTs should not have been taken lightly. They also didn't provide any thyroid collars or lead aprons during any of the CBCTs. So with all of that being said, Dr. Heng definitely didn't act in accordance with the as low as reasonably achievable principle, since there were many things he could have done to reduce the amount of radiation given to me. It's worth noting that I've been having issues with my thyroid since concluding this treatment. And so a couple weeks ago, I ended up getting a thyroid ultrasound done, and they found multiple thyroid nodules, a couple of which are solid. My follow-up appointment is until after I post this video, so I don't know if they're cancerous yet, and I don't know what the next steps are with that, and I also can't say whether this X-ray exposure is what caused the nodules, but it is certainly unusual for someone at my age to have this many thyroid nodules, and exposure to radiation is a risk factor. As an aside, Dr. Heng had told me that both him and his wife lost their mothers to cancer, so I would have thought they'd be a little more careful with radiation. One last concern is that Dr. Heng's Facebook page says, "Our goals are to pay careful attention to the health of your airway, to protect and/or expand the airway, and a person's airway is not compromised and often can be improved. A compromised airway can be associated with TMJ problems, headaches, and sleep apnea." Dr. Heng often uses CBCT airway cross-section to show how his treatments widen his patients' airways. For example, this was a surgical case from his Facebook page. He shows us the specific millimeters of cross-section change, and then states that this change led to the patient feeling better. And here's another example. Now, in my initial email to him, I said, "Sometimes I feel like I can't breathe very well." And in his referral letter, Dr. Heng said, "We're in the process of giving her back her tongue space, airway, that she's lost due to the retraction." So considering how airway focused Dr. Heng supposedly is, you'd think that he might have mentioned this to me. Here is my pre-treatment airway cross-section, 192.1 millimeters squared, and here is my post-treatment airway cross-section, 100.1 millimeters squared. This shows that my airway size decreased by nearly half over the course of his treatment. Considering he uses this measurement to advertise his treatment, and considering that he claims to pay careful attention to the health of your airway, you'd think this would have been something worth bringing up. At the end of August 2021, Dr. Heng's wife, Debbie, sent me this email, asking for permission to use my photos for social media posts. Needless to say, I was very confused, because they know that they didn't address my pain, and they know that they messed up my teeth, so why were they wanting to post about me? I decided not to respond, because I was trying to move on with my life, and doctors need written permission to disclose their patients' personal health information to anyone, let alone as an advertisement. So my lack of a response was a response in itself, a resounding no. So I didn't respond, and I didn't think about it again. I didn't get any follow-up emails from them, so I thought it was over. But on January 19th, 2022, I decided to check out Dr. Heng's public Facebook page, just out of curiosity. I scrolled down a bit, and suddenly I saw my name and my face. I panicked. I had stopped using social media, hence no longer having a Facebook account, and I don't like my information on the internet, let alone on Dr. Heng's Facebook page. I even told him that I was trying to get away from the internet and social media, including an email where I told him I was doing an internet detox. He also knew that I was moving to a remote area to get away from it all. When I finally built up the courage to look more closely at what he posted, I saw that it was a 3-part video series, as well as my intraoral upper and lower arches, and my side profile with my eyes blocked out. First, I never gave them permission to do any of this. This is the only thing I signed that they have on file. Posting an advertisement on your Facebook page is not research, education, or publication in professional journals. Here is the side profile picture they posted of me. Even though they blocked out my eyes, people can still tell it's me. He wrote, "Profile improvement from non-surgical orthodontic treatment," and put these profile lines on my pictures. He makes it seem like my face grew practically a centimeter forward from his treatment, without surgery. He even makes it look like my nose grew. How could that possibly happen through only moving my teeth? If you overlay these two pictures, it's clear that, for one, my head is tilted slightly upward in the second picture, and my lower jaw has not moved forward at all. While at first it looks like my lower jaw has moved forward, the changes you see are simply my lip position changing due to my teeth being pushed forward. I also lost about 20 pounds between these two pictures, and I did myofunctional therapy, so I had learned how to put my tongue on the roof of my mouth, which makes my jawline look more defined. This is clearly false advertising, and I can make that claim because this is my face. And I know that my face did not change in the ways that this post implies. And Dr. Heng knows that too. He's not stupid. This was intentional, because he didn't just copy this profile outline from the first picture and drag it over. No, he rotated the outline on the second picture, and he rotated it in the opposite direction of my head tilt, which amplified the illusion that my face grew forward. So this wasn't just a sloppy accident. He sat down and purposely edited this. Also notice how he never shows the pictures of my teeth from the front. If he did, you would see the gum recession and how janky my smile looks. And now for the videos. I'll just play them for you and then jump into comment.
Ireland is one of the most unique and very interesting people that I've had the privilege to treat. She's a very bright girl who was a student at
So he starts by saying my full name and the university I attended, which is a total breach of my privacy. I also don't appreciate my doctor using my university affiliation as a way to promote his treatment.
And when she was growing up, she had typical orthodontic treatment, was not informed about the nature of what was going to happen for her. She had bicuspid teeth removed, and she's very bright. She saw the changes to her face that she did not like. She started exploring about this on the internet and educating herself about it. She contacted me on her own, and I believe we did a long-distance consultation via Zoom initially, and then she came and we started the treatment, the usual protocol that I have of reopen ear spaces. Largely her complaints were aesthetic. Because
Looking back at the first email I sent to Dr. Heng, only 6 words out of my entire email mentions looks. All the rest describes the physical symptoms and pain that I was experiencing. That to me doesn't sound like my complaints were largely aesthetic. I even said I've been in pain for years now. Going back to this email, I said my number one reason for reopening my extraction spaces was to alleviate the feeling of my lower jaw being trapped. If I just wanted to look better, I could have spent the $19,500 on plastic surgery. But I really don't care enough to do that. Rather, the health of my jaws is and always has been my main focus. This doesn't even include the countless conversations I had with him in person and over the phone. But those conversations don't even matter. This email is all he needed. There is no other possible way to construe this. The health of my jaws is and always has been my main focus.
Largely her complaints were aesthetic because she saw what had happened to her face, the sinking in of her cheeks and her lips and everything. And she'd look back at the pictures of herself prior to that, and she was, to put it mildly, incredibly unhappy about what had happened for her.
And now, he makes it sound like I went on some rant with him about how distraught I was over my face. While I certainly didn't like what I felt had happened to my appearance growing up, those 6 words in my first email were the most emotional I got about it with him. I hate the way it looks. And that was in reference to how I looked with an underbite and mentalis strain. But my appearance was never my chief complaint. And I also never had a conversation with him about my appearance like he implies.
So she was a great patient. She did exactly what we asked her to do, and along the way she would send me pictures, particularly early on, and say, oh my gosh, these symptoms went away, I'm so happy, and she's very happy with the way things look.
So now he talks about how I sent him emails, particularly early on, about how my symptoms were going away, which is in reference to this email I sent not even 2 months into treatment with him, where I said I was starting to feel better. But then he fails to mention the many conversations and emails that happened after those initial emails, where I told him that my symptoms had come back and my jaw was still trapped. I find it hard to believe that Dr. Heng can remember so many small and really insignificant details about my case, like that I contacted him on my own, and that we had an online consult first, as he stated in this video, all events that occurred years ago. But he can't remember all the conversations and emails within the past year where I told him I was in pain. Also, he mentions that I said, I'm so happy, and I just don't appreciate having words put in my mouth like that, because I never said that. That's not even how I talk.
She did a lot more research on her own and into the whole orthodontic profession. And she's contacted other people around the world. She's done videos and explored the history of the orthodontic profession. And she's a woman on a mission. She will do well in life, whatever she chooses to do. I'm really happy with what we were able to achieve for her.
He then says, I'm really happy with what we were able to achieve for her, which is just so bizarre, because how could he look at my mouth and be pleased with the results?
And to know of her commitment to this and to help other people. She basically is one of those people who said she'd do anything to prevent this from happening for other people.
Now you might be wondering, why am I so upset about this video, since he clearly compliments me? Well, the thing is, he never showed me the videos, so I never received the compliments from him. So I think it's fair to conclude that this compliment was never actually intended for me. It was intended for Dr. Heng's audience as part of his advertisement, to show his audience that, oh, intelligent people get this treatment. But I think what this really shows is that even supposedly intelligent people can be taken advantage of. Also, in the caption for the 3rd video, it states, she was so pleased with her results that she has become an advocate for people dealing with similar situations to hers. This is pretty wild to me because, for one, I am not so pleased with my results. 2, I started being an advocate in 2019, only 9 months into my treatment. And 3, I took down my website and removed my YouTube videos in 2020, before I even had the end results of his treatment. Dr. Heng and his office didn't know that I found those videos. I didn't mention it to them. Instead, I sent this email asking for my records. Nowhere in the records they sent me was any mention of the videos and pictures they posted on their Facebook page. And I'll also note that I later figured out they also have an Instagram page that I never checked, and looking through what's on that page, it contains a lot of what they put on Facebook, so there's a chance that this was also posted on Instagram and I just wasn't aware of it. But anyway, that group of doctors who reached out to me to look at my records, they urged me to sue Dr. Heng, but I didn't really consider it at first. I was so confused, and I also thought that suing was mean, so I insisted on giving him the benefit of the doubt. But after finding these videos, I started consulting with attorneys, because I felt really violated by how personal this was, and why he would say all of these things about me online behind my back. It honestly made me mad, because I was such a good patient. I was so respectful to him, and I made the choice to try to move on with my life and not come after him, even though he damaged my mouth. And then he does this. So even though these videos were violating, they were also validating in a way, because I spent so many months thinking that I was insane, questioning myself, and thinking that I just didn't understand what was going on and was missing something. But now I had proof that Dr. Heng was gaslighting me. So I started consulting with attorneys. I still felt like suing was a mean thing, but with everything that had happened, I was more open to the idea. But the attorneys were upfront with me about the process. They told me that, for one, California dental malpractice law is much more favorable to dentists. So unless you're suing for millions of dollars, many attorneys won't even take your case. They also said that if I filed a lawsuit, this had the potential to drag on for many years. Also, even though my case is strong, it's very complicated, since it happened over the course of years. So it wouldn't be an easy win. It might be too boring for a jury, and they could just not care. And it's too bad that it's just the luck of the draw with the jury. And see, it's things like this that just seemed like too much of a risk for me, that I could spend so many more years of my life thinking about this, and preparing my case, and going through all of that stress, and have it all come down to luck in the end. It just didn't seem worth it. The attorneys told me, basically, no amount of money would make what was done to me right, and it might be better for me to just try to move on with my life. They did, however, bring up that I could file a HIPAA complaint against Dr. Heng instead. Now, I wouldn't get any money out of it, since the fine goes straight to the government, but since he had undeniably violated HIPAA, he would for sure face consequences this way, and I would avoid a legal battle. This seemed like a much better plan for me, because ultimately, as long as he was held publicly accountable, I could accept leaving this situation without financial compensation. So I decided that I'd take the attorney's advice, and I went down the HIPAA complaint route instead of suing. So I filed the complaint in July 2022, and it was my understanding that Dr. Heng was under investigation by the Office for Civil Rights. And then in February 2023, OCR sent me this letter saying that they received my complaint and that I alleged that on January 19th, 2022, Dr. Heng discussed my treatment in a video series and that this allegation could reflect a violation of this law. Then they said, "We have carefully reviewed your complaint and have determined to resolve this matter informally through the provision of technical assistance to Dr. Heng's practice. Based on the foregoing, OCR is closing this case without further action." So, one thing that immediately jumped out to me was that they said that they carefully reviewed my complaint, but I said in my complaint that I found the videos on January 19th, 2022. But the videos were posted in October 2021. So that, to me, seems like they didn't actually look at the videos that Dr. Heng posted, or at the very least, they didn't carefully review my complaint. I was frustrated by this, but I figured I could appeal the decision. So I sent this email, telling them again why the videos were important, and I said, it doesn't seem fair that my doctor can use my face, name, and university in an advertisement without my consent, and spread false information about me online without any consequences. I told them that I felt very violated by this, and that I have no way as a patient to defend myself, and I asked them if they could open an investigation into this. But they responded and said they are not able to reopen the matter at this time. So that's it, I guess. I should have known that a government agency wasn't gonna help me. But I don't know, I just thought this is illegal, so he's gonna face consequences. I never considered the possibility that he would completely get off the hook for it. I just feel betrayed because I chose to file a HIPAA complaint instead of suing him, since I was under the impression that OCR would stand up for me as a patient and hold Dr. Heng accountable. And I mean, I looked into this before I filed the complaint. On the ADA's website, I found this, what are the penalties for violating HIPAA? And it lists some tiers. The first is that the doctor had no knowledge of the violation. The second is reasonable cause. The third is willful neglect, corrected within 30 days. And the fourth is willful neglect, not corrected within 30 days. And considering the videos were up for 3 months when I found them, and were up for over a year before they were actually taken down, I assumed that this was tier 4. It says, in many cases, the maximum penalty amount will not be imposed. Instead, the government will determine the amount of a penalty on a case-by-case basis. But that doesn't really matter for a tier 4 violation, because the minimum penalty is $50,000 and the maximum is $50,000. Going back to the email, they said they couldn't make any claims about the other allegations, referring to my claim that Dr. Heng lied about my treatment and used me to falsely advertise. But I recognize that that's not their jurisdiction. I didn't expect them to handle those issues, but I was trying to show them the whole picture and why this was such a big deal and why it affected me so much. It wasn't simply that he posted a picture of me online. It's that he posted a picture of me and all of these other things. But it does list below that the government may waive a penalty in whole or in part to the extent that payment would be excessive relative to the violation. So maybe one could argue that a $50,000 fine is excessive. But my doctor got over a year of free advertising out of me. He likely made money off of me when I told him and his social media team that talking publicly about my experience was taking a toll on me, and I didn't want to be online anymore. He used me to promote a treatment that harmed me, and used me to convince other patients to subject themselves to that same treatment as well. I would argue that some kind of penalty is warranted. So yeah, the HIPAA complaint fell through, and by this point my statute of limitations for a lawsuit had expired, so I couldn't sue him anymore. But I still wanted to hold him accountable for what he did. I mean, it's not okay that he could do all of this and never have to face any consequences. So that's when I started working on this video. I don't have a big platform or anything, but I thought this was my only option left, to just take it into my own hands. When I was consulting with attorneys previously, I'd put together this big document explaining my case, so I just used that document as the foundation. I had the whole skeleton of this video made, and I even posted a video on this channel saying that I would have this video published within the next month. And that was back in March 2023. But then something about all of this just didn't feel right. For one, I still didn't feel comfortable being so personally involved in this field again. I care about this topic, yes, but I don't want to reveal my name or face online, and I don't want to be seen as a public figure. This is still very raw, and I really don't want to be sharing my story and personal information. It just doesn't sit well with me that Dr. Heng violated my privacy, and now, in order to get any amount of justice for this, I have to give up even more of my privacy. So I started brainstorming if there was a better way to address this than posting a whole video about it. And since you're watching this video right now, you can probably imagine how this went. But I decided to write him a very candid email, which was essentially a summary of my treatment with him, all the side effects I was having from his treatment, and how he made me feel. I finished off by requesting for him to please refund my family for the cost of his treatment, to cover my travel expenses and medical bills as a result of his treatment, and to issue a public apology for lying about my case to advertise his treatment. I figured it was good to give him a chance to respond and make things right before posting a whole video about it. But he didn't respond. Instead, I got this message from his wife saying that they received my email, but we feel we need advice on your proposal, and that will take us some time. And for context, I'd put a date that I wanted him to respond by, because I didn't want this to get dragged out forever, and I also figured that if he was sorry, he'd just say he was sorry. Like, you don't need much time to do that. And to be clear, I was just looking for a response as to how he would proceed. He didn't have to have a whole apology video made and posted in that amount of time. So I don't think I was being unreasonable. But anyway, I emailed back and asked how much time they were thinking that would take. And she said they didn't know, since they were relying on others. So I was a little puzzled by this. I figured maybe they were asking a lawyer about it. Then, a few weeks later, I got an email from the claim manager for the American Association of Orthodontists Malpractice Insurance Company on behalf of Dr. Hang. I was confused why a malpractice insurance company was getting involved in this, because I couldn't sue. But anyway, the claim manager requested to speak with me over the phone, but I didn't feel comfortable having a phone call about this, so I said that I would like to keep all communication regarding this matter in writing. Then she requested documentation for the compensation I was asking for. She also said, "I'm sorry, but I am unable to control your request for the public apology. For your information, though, Dr. Hang is now retired and has surrendered his dental license. He no longer resides in California." Which is true. He has retired, but he's still working in the dental field. He has a website where he offers 2 different mentorships. One for early childhood orthodontics called the Echo Mentorship, which is $12,500 per year, includes monthly meetings, 2 of which are in person per year, and the other mentorship is for ERRS, Extraction, Retraction, Regret Syndrome, which also has monthly meetings, with 1 or 2 being in person, and that one is $1,485 for the first 3 months and $495 per quarter after. Looking around on this site, it says, "The bad news is that ERRS is prevalent and largely undiagnosed. The good news is that ERRS is preventable and reversible. A growing number of orthodontists and orthodontists are joining Dr. Hang in diagnosing this syndrome and offering treatments that patients are gladly paying for." And then, ERRS treatments can help your patients and your bottom line. We are not practice consultants and do not like to focus on the economic aspects of orthodontics. However, clear aligner marketers and increased competition continue to hurt bottom lines. ERRS treatment techniques are in high demand worldwide. Our experience is that these patients will travel great distances to access them and willingly pay a fee reflective of the expertise required to complete the treatment successfully. If you are an orthodontist or dentist experienced in orthodontics, adding these treatments to your practice is a triple win for you, your patient, and your bottom line. So, anyway, all of that is to say, sure, Dr. Hang is retired from practicing orthodontics, but he is still a public figure in this field and is making a lot of money off of teaching these techniques. Going back to the email, though, she said she's unable to control my request for the public apology, so I figured that the malpractice insurance company could only handle the financial portion, and I'd just revisit the apology with Dr. Hang separately. They wanted itemized invoices and medical reports for the dentures, periodontal surgery, and orthodontic revision, as well as the basis for my request of $300 per appointment and travel expenses. So I compiled all my supporting documents. A lot of it is personal information though, so I'm not going to show it, but it was 78 pages of all of my receipts for flights, hotels, car rentals, maps of the exact routes I drove and their corresponding miles, and then gas prices at the time of each trip, and an estimate of car gas mileage to get a rough cost of gas per trip. It actually came out to an average of $339 per appointment, so I thought my $300 estimate was reasonable. I also included insurance statements, a quote for another set of braces, invoices and bank statements for the dentures and gum graft surgery, and so on. She responded and said, "You did an excellent job of explaining what you did dentally after your treatment with Dr. Hang and outlining your various expenses. I've had a chance to review it all, and based on your thorough explanations, AAOIC will agree to pay you $32,321 per your request if you agree to sign a release. If you have no questions after reading it carefully, sign and return it to me, and I will see that a check is prepared and sent to you immediately." I was actually shocked by this, because, to my knowledge, insurance companies don't usually give the full amount requested, and there's often a negotiation period first. So it was strange that they were giving me what I asked for down to the dollar. So then I opened up the attachment, and it was a confidential settlement agreement and release. It says that it is a full and final compromise, and not considered an admission of liability by Dr. Heng. There's a non-disclosure clause saying the existence of the underlying settlement and the names and backgrounds of the settling parties shall not be disclosed by any party or party representative. Then a non-disparagement clause, which says the parties agree not to disparage each other. Negative postings as to the other on any social media website of any kind are expressly prohibited. So this was not good, because I wanted Dr. Heng to apologize and take accountability. That was the main reason I reached back out to him. But in order to get the money, I had to sign this release, which meant that I would never get the apology. So now I was in a really tricky situation, because over $30,000? That's a lot of money. My family and I really need that money. And I think that was probably the point. Offer me a life-changing amount of money, but no apology. Take it or leave it. And try to get away with not taking accountability. Essentially, hush money. So I asked if I had to respond within a certain amount of time, and she said, "Do you want this done by the end of the year?" I was pretty overwhelmed with this decision that I now had to make, and it was also the holiday season, so I wanted to give myself some time and said I'd respond by January 5th. I pondered it a lot, and ultimately it came down to this. What would I regret more? Not taking the money, or letting him get away with it? Really, this wasn't even his money. He wasn't writing the check. His insurance company was. And while that money would be huge, I can always work more. I will make that amount of money in my life eventually, and I will pay my parents back. But just letting him get away with it, on the other hand, that would haunt me forever. And I wouldn't be able to talk about it with anyone because of the non-disparagement clause. So based on all of that, the money was a much worse deal for me. So I decided that I wasn't going to take it. Not unless they removed the non-disclosure and non-disparagement clauses. So I responded and said, I am unable to sign the release under the current terms. I explained that profit wasn't the goal for me, and the public apology and accountability were more valuable, and even foundational to me reaching out to Dr. Heng in the first place. But I explained that I did see the value in just having this be over, accepting the $30,000, and moving on. So I said, before I can consider signing a release, I would need to know Dr. Heng's understanding of the value of my concessions, and by extension, my willingness to sacrifice full closure in exchange for settlement. I wanted Dr. Heng to acknowledge that by me accepting this deal, he was getting away with what he did, and would never have to take accountability, all while taking away my ability to get full closure. I was really hoping that I would get a response from him directly, but the claim manager responded again and said, I've spoken with the doctor about your feelings concerning your treatment and the damages you have sustained, both physical and emotional. He is empathetic to your feelings and wishes. His policy requires that he consent in writing to settlement, and he has consented to this settlement. He regrets the problems with which you are dealing and wishes you the very best. He is now retired completely from the practice of orthodontics. I'm sorry that the company cannot elicit a public apology from him. I can hear how important this is to you. I do believe the doctor is acknowledging your feelings through these actions. So, I responded and said, I appreciate that you spoke with Dr. Heng, but he still hasn't taken accountability for his actions, nor has he acknowledged the clear value he gains by not apologizing and then having me sign an NDA. As I stated in my original email, it is incumbent upon me to hold Dr. Heng accountable for his actions on behalf of myself, my family, and the public. I recognize that he isn't practicing orthodontics anymore, but all of his content is still available online, and he is actively selling mentorships. Therefore, he is still a public figure, and it places a large psychological burden on me to keep this situation a secret when Dr. Heng publicly lied about my case to promote a treatment that harmed me and could potentially harm others as well. As much as I would like to accept this financial compensation, no amount of money will get me to sign an NDA. Staying silent makes me complicit, and that just isn't worth it. So, you'd think that would be the end, but after all of this, I still didn't really feel right about posting a video. I thought maybe I wasn't clear enough in that email I sent to him, and maybe he did think I was trying to sue him, and so he was being extra careful and going through the insurance company. So I decided to email him one last time. I wrote, as I'm sure you're aware, I have declined your settlement offer. Your decision to pass this matter off to your malpractice insurance company instead of handling this personally was disappointing. However, I'm going to give you the benefit of the doubt and assume that you misunderstood the purpose of my original email. To clarify, I have no intention of suing you. The goal of my email was to reach a genuine resolution without third-party intervention. As I explained in my email, I decided not to sue you because I was confused by your actions, and at the time, I felt that suing you would be mean. To elaborate on that point, I settled on filing a HIPAA complaint against you instead, and my statute of limitations expired soon after. The Office for Civil Rights ended up closing my case without an investigation, and this is what led me to reach out to you personally in search for a resolution. I've been seeking redress for this situation for years now, and it's all taken a toll on me. Even if there's some other route I can take to sue you, I don't want this to take up any more years of my life. I truly want to put this behind me and move forward to the best of my ability. That said, it still doesn't sit well with me to leave this situation unresolved. So I'm asking, this time with the understanding that I am not suing you, will you take accountability for your actions during and after my treatment? And he responded, I turned the matter over to my insurance carrier as that is what I thought you wanted. I wanted you to know that I treated you from an orthodontic perspective using my best judgment, but outcomes are never guaranteed. I regret that you are now not satisfied with my efforts. I retired a couple years ago. I too want to move on. With this email, I hope we can both do so. I wish you the best. So, that's it. This was his opportunity to at least say he was sorry, but instead he ignored pretty much everything I'd said and blamed me for not being satisfied with the damage he caused to my mouth. There was no regret for posting my personal information online, no regret for turning my case into a false advertisement. No, he pretty much just told me to get over it. But ultimately, this isn't just about me. Yes, this has had a very negative impact on my life. And yes, I wish there would be some consequences for what he did to me. But even more importantly than that is that he made my case public illegally and then twisted it to make my treatment look like a success, and he refuses to acknowledge that. Patients trust doctors to be honest and ethical, but he's broken that social contract. He has lied to the public for profit, and that is unacceptable, dangerous behavior from a healthcare professional. So, I will end this video here. Thank you for listening to my story. I know this has been a really long video, but I really appreciate your time. I'm so grateful to finally be getting this off my chest, and I'm excited to move forward now and hopefully fix my teeth.